Good morning. Good morning. Hi, guys. This is LaQueen. Okay. Battle First Aid Responder Services here in Boston, Massachusetts, at my office here in downtown Boston. I do community first aid, adult and pediatric first aid, public safety for just general public safety events, as well as I'm a certified medical assistant. I am certified working on my peer support certification with the state of Massachusetts, as well as I've been doing training with the World Health Organization and the CDC. I'm also certified um, Narcon, naloxone opioid recovery. So I am certified to do overdose counseling as well as overdose assistance. So, okay, great. And I'm also working on my graduate degree right now for nursing and eventually going into medical school. So bear with me, guys, okay? Briefly, I'm just going to talk about quick things. I did just do a brief 20-minute video on it was quick and sloppy 20-minute video on the COVID-19 virus response. It was really quick. I had some issues with my camera for over the past week, but I'm just trying to pretty much get as much focus, and I will be doing a webinar to try to on Eventbrite. I'm gonna have to go get a room tonight or whatever. Try to focus and again review, get back into my Eventbrite that I've been behind on, and then pretty much get ready for the upcoming Democratic National Convention as well as the Republican National Convention. Get with their people, get with their organizers, see what they need. And there's still going to be people at these events. There's not as many 50,000 or 30 or 20,000 people, attendees, delegates, but there are still going to be people present in Milwaukee and in Charlotte, North Carolina. So just for the spirit of it, I will be in both Milwaukee and Charlotte. Okay, great. Okay, now, again, my name is LaQueen Battle. This is my company is Battle First Aid Responder Services. Now, I am a medical professional. Okay, I do have a lot of bones in my closet. Okay, it's just general. When you are rising up, leveling up in your medical field, you will have a whole bunch of bones in your closet that will come up after you, come up against you, whatever it is. If you want to try to get to where you want to get to, you will have bones in your closet. They just come, oh my God, here's another bone. Oh, here's another bone. Oh, here's another bone. Oh, this is another issue. Oh, this is another issue. Oh, this is the issue, very important issue right here. Okay. You still have to keep progressing. I mean, the times are changing. The generation, the squirrels of the old people are changing. I have other bones in my closet like this one right here. And this one right here. So pretty much I'm just kind of going through my phase right now. But you guys just work with me here. Okay, work with me on a lot of issues right now. I need your help. I need you to continue to keep me in your thoughts and prayers. I'm still going through a lot of other issues. This is another bone in my closet I have right here. I have no idea. So guys, please continue to keep me in your thoughts and prayers. There's a lot of problems here in the Boston area, and just general, you're dealing with a big city, over 1 million, 2 million people. Okay, you're dealing with a lot of issues with a big city. Okay, and when you are dealing with big issues with big cities, you're going to be exposed to a lot of crime, harassment, assault. It's general. But some things you can tolerate, some things you can't. Okay. So right now I'm on my knees and legs begging to figure out an answer. And so pretty much I'm just trying to open up as many doors as I can possible to get to where I need to go to. And I'm very thankful for the opportunity to have this space and to do what I need to do. Okay. I'm very thankful. But again, like I said before, I have a lot of bones coming up in my closet. Okay. And I'm going to these conventions. I'm going to meet people. Okay, they've already met before, but I'm going to meet people that are of affluence. And when you rise up in your career, sometimes people will come out of you, male, female, young, old. Arrows will be coming out of you from every single corner of the world, literally. literally arrows, bow, straight shooter arrows. They don't like you just because. But you know what? It's normal. It's called politics. Seriously, it's called politics. It's called politics. So, work with me, guys. Here, I'm just trying to get to the issue. That's not what I want. That is not what I want. So again, if you don't know your history, you are bound to repeat it. Seriously, seriously. If you do not know your history, if you do not know your history, there's something going on. It's 1:15 here on Sunday. If you do not know your history, you are bound to repeat it, literally. And I was raised in the South as well as on the East, West, and I was raised in Forward, Texas, and also Los Angeles, California, which is pretty much where my family is. Most of my family is in LA, so they're not dealing with the COVID-19 virus as much as the other relatives that I have in Texas. But I have more relatives that I do not know about in California than I do in Texas, as well as Louisiana. I have a lot more relatives that I do not know about in Louisiana. I have a whole bunch of relatives in New Orleans, which is normal. It's normal. It's normal to have relatives in New Orleans. I have relatives in New Orleans that I do not know about. My grandmother, she's from New Orleans. One of my grandmothers. Okay. All right. So let me get to this right quick. Okay. I don't have a lot. I don't have a lot of information that I thought I did. This is horrible. On my papers. I have to get through this stuff. I really do. Okay, you know what? Forget about it. Let's just get to the bones of it, okay? Now, COVID-19, there's a lot of issues going on right now, okay? All right. I have family in California. I have family in Los Angeles. I have family in Dallas. I have family in North Carolina, New Orleans, Florida, Georgia, Atlanta, all over. Okay. But most of my family is down south. Okay. And so I'm getting a lot of heat right now from them because COVID is spreading. Okay. It has pretty much already hit. It has pretty much already hit the East Coast. Okay. The big cities. Now it's going, of course, to where my family is. I'm not getting any calls, but I'm getting a lot of familiar faces in Boston. Okay. So they're coming to me to literally breathe the air I breathe, fresh air. Okay. So it's really, really crazy because this COVID-19, I mean, it's been going, this virus, literally. I really want some good facts about this virus. I really need some facts. I mean, I really need some facts. I really, really want to get this for you. Okay. Let me get some quick facts. So good morning, YouTube. Good morning, YouTube. And there's another protest today. So I'm going to go ahead. Okay, so it started in 2019. No. Okay, so the COVID-19, I'm looking right here on the World Health Organization website, okay? So the COVID-19 virus was declared a it was declared a national public emergency on December the 31st, 2019. Okay. Okay. All right. So okay, so it was declared a national emergency on December the 31st, 2019, last year, about 6 months ago, okay? Now, currently, as of this morning, okay, August the 8th, Saturday, 2020, there have been confirmed cases. Here's the total now confirmed positive cases of COVID 19 virus at 19,187,943 cases worldwide, according to the World Health Organization. This is not the CDC America. This is the global World Health Organization. Okay, this is the global World Health Organization. Okay, it has declared 19,187,943 confirmed cases of COVID-19. This is the World Health Organization. Okay, which I know that, of course, our current administration on office has an issue with the president, uh, Dr. Nitras, of the World Health Organization. Okay, so now this is just um, an opinion. Okay, I'm going to be using more facts than opinions to try to pretty much get what I'm doing. All this research I have been doing since Albany, since going on for almost a year. I've been doing this research on and off. I have it published on YouTube as well as on Facebook and Instagram, and the webinars that I've been doing to pretty much I've been over 20 different cities, probably over 30 different cities within the past year and a half. But that's not when COVID started. COVID started in December. And in December, I was in the capital of New York. You understand what I'm saying? So when I was in New York, in the capital, in front of all those senators and legislators, I was still, as a medical assistant, first aid, just going through volunteering in the building, I was still able to see in December of 2019, just this past 8 months, almost a year ago, I was still able to see that even New York State had the virus under control. They had doctors, they had staff, they had clinicians coming in to see the senators every single day. Clinical staff in professional scrubs and jacket coats. Okay, clinical coats coming in. Their names are certified on their jackets. I am a certified professional, board certified MD, board certified RN. I have everything you need. I know it's going to happen. I know what you need to do. I have the symptoms. They had teams of 20 medical students, 20 doctors, 30 doctors every single day. Literally. It started about I was December. I was in Buffalo, Albany, Buffalo, Syracuse. I was in okay. I was in Syracuse October, November, December. Okay. I was in Buffalo, New York, one of the busiest upstate cities in New York, about August, September, October. Now, that's when the flu season started. The flu season started about usually the flu season. I want to make this clear. I really want to get the focus across this clear because there's a lot of misconstrued statements about really what's going on. Okay. Sometimes it can be a little bit misconstrued. Can you guys hear me? You can hear me good. Okay. sometimes it can be misconstrued about what is really going on in an epidemic, and people they really don't know until, oh my god, it comes knocking on the door. You see what I'm saying? So we just got to get the facts clearly across so that people can really understand, and that I can really do webinars about this, because I'm going to be going to these events, okay? And people actually need to know what is really going on. Do you see what I'm saying? Like, what is it really? We don't understand what's happening. What do we need to really do about it? Okay. All right. So the flu season, here it is, right here by the Center for Disease Control. Okay. This is so bad. I wish I had it. I wish I knew how to split screen. Okay. So it pretty much says that the flu season starts right here. When is the flu season in the United States? In the United States, the flu season, the fall and winter. It's usually done the fall and the winter. Okay. Virus circulates year long. It usually starts between December. Oh, well, anyway. So the flu season, usually the normal God, I'm really gonna have to get this off to people. I'm really gonna have to get people to understand, okay, that understand that this is normal. Okay, what's going on right now around the world is normal. Okay, there's a normal pattern flow of normal flu season. Okay, understand that. Okay, but at the same time, though, it's how you respond to the situation that lets it know it's a little bit out of control. Okay. All right. So the normal flu season, I'm trying to go to a thing today. I don't know if I made it. Okay. So the normal flu season starts about October through March. Okay. The normal flu season in the United States, not in Africa, not in Europe, not in London, not in Paris, not in Germany, not in Berlin, not in Mexico, especially not in Mexico, especially no Caribbean islands, not in the Caribbean at all, because the Caribbean climate is different. That's what makes the flu season different from different people. It also has to do with the climate, with the humidity, which people are usually surrounded with. So a lot of islanders right now, they're like, flu, COVID. Oh, we don't have to do that. We deal with worse issues in our island, in our hometowns. Do you know what I'm saying? So a lot, excuse me, itching my hair. A lot of Caribbean people, um, they kind of have like a lackadaisical response to this virus, because to them it's normal. Do you know what I mean? They've dealt with worse. Okay, especially Nigerians and Kenyans. Okay, so in the United States, just in the general population of the United States, okay, love my maps. I love my maps. Okay, so just in the general population of the United States, okay, the flu season starts from October, November, December, January, February, and then it ends like when spring, at the beginning, the equinox of spring. Okay, so it's, oh my God, I just like, it's a lot. I'm doing a lot because I mean it's affecting me as well as everywhere I go. Okay, because I'm caught in it. I'm pretty much caught up in this. Okay, so the flu season starts at the beginning of fall. Fall usually starts about September. Let me see, because I want you guys to understand that it's a normal pattern of life. Okay, so start. Okay, so here we go. Great. I love this. Okay. So in the northern hemisphere, which is the United States, winter usually starts about fall usually starts about September, the beginning of September, maybe the 1st, maybe the 15th. Okay. Winter usually begins about December. Okay. But lately, because of global warming, winter has usually started about maybe January, February. February, when it gets the coldest, especially Chicago, cities like Chicago, upstate New York, even Seattle, San Francisco, winter really, because Seattle and San Francisco is more humid, but winter, especially in the Midwest as well as the East Coast, and Boston, New York, Philadelphia, and DC, especially DC, it really is mild. It's a mild winter until about late January Then February comes, and that's when winter starts. You see more of the snow coming in, pouring in. You see more sleet on the ground. Okay. But it's usually a mild winter up until maybe late December. It's usually mild. Now, if there's a tropical storm, if there's a thunderstorm coming in, a winter thunderstorm, then that's when it will increase the flow. You guys know what I'm saying? Because there's a natural flow to this. Global warming is a natural flow. It's a natural flow to the weather. The weather has its own natural flow. The seasons have their own natural flow, as well as the virus. The human body also has its own equilibrium, its own time, and its own natural flow. Now, when the human body, okay, you guys following me? You following me? Okay. I don't have anybody on my live today, but it's fine. I'm gonna be doing these literally, I'm gonna be doing this all day. Okay, so when the human body has its own equilibrium body clock, and the clock, the normal time, the seasons change, are not able to be on that same level, on that same equal status. The human body's clock is not on the same status as the normal nature clock. Then that's where diseases occur. Then that's where there's a conflict. Then that's where there's infections. There's cancers. There's viruses, flus, pneumonias, coughs, allergies. There's more there's more unbalanced irregularly, because usually the normal pattern of life, okay, there usually is, sometimes it's in, I'm touching my face, sometimes it's in the air, the weather, or sometimes people's bodies are not able to adjust to the climate of whatever city they're surrounded in. So say for instance, you were born in the South, you were born in Georgia, and then all of a sudden you move to Seattle for a job. You are normally going to get sick. Okay, normally the pattern of life is, you know what, I might catch a cold, I might get pneumonia, because my body is not able to adjust to the change in climate, the change in status of me going from a place of low low status, low, underground, the low ground level, and then me going to a higher ground level. Do you understand? Going for low oxygen to a higher O2 oxygen case in my body. Okay. So there might be another influence of infection, or you can be going from the East Coast, from a busy, industrious, smoggy city like New York City, and then you want to go to Hawaii. You move to Hawaii just to be closer to your family. Of course, your body is definitely going to have to adjust to moving from New York to a warm and sunny and breathable, you know, state like Hawaii. You know what I'm saying? Or if you're in Mexico City and you have to go to Alaska for a job, of course, your body is going to have to adjust to the climate of the flow of your surroundings, as well as the humidity in the air, as well as the weather, as well as the warming, the natural global warming patterns. Again, that's the normal homeostasis pattern of the human body. It's normal. I've had like my second cup of coffee today. Now, that is normal. That is humankind on its own level is normal. That is a normal part of the human body. When humans have to relocate, or when humans have to meander our journey to different regions for better food production, for a job, for better survival of their families. Naturally, the natural evolution, I'm not talking about a fake evolution where we just busted our stars, but the natural evolution of our bodies, as well as our internal systems, has to adjust. Okay, it's evolution, but at the same time, it's a natural evolution. It's a natural evolution. Our bodies have to adjust to the natural evolution of the climate that we live in. Okay, now, if your human body is not on that same equilibrium pattern as the climate which you have just moved in, the rapid climate adjustment, there's going to be conflict. You're going to get more sickness. You're going to get more colds. Your body's going to get more infections, and you may develop other immune diseases, because you have to adjust to that change in climate as well as that change in temperature. Okay. So I just want to make that clear because it's more common sense understanding, okay, COVID-19 is different. It's the devil. No, it's not the devil. It is just the normal pattern of life. Okay. Now, China has been knowing this for a long time. As you see on China, every single time, every single year you see people in China. What do the people have in China? They always have their masks closed. You know what I'm saying? It's natural. You have to adjust to it. Like I said, you have to adjust to it. Now, the start of the autumn is September the 1st, about September the 15th. The winter starts on December the 1st, and the spring starts about March, April, May. That's the normal pattern. Okay. Now, when the seasons change because of the global pattern, the global climate, okay, and this is not what Dr. Fauci is talking about, okay, and Dr. Tedros, they want to get straight to it. Dr. Fauci, Dr. Tedros, and the WHO, and Dr. Fauci, and on the coronavirus task force, they want to get straight to it. What are the symptoms? How do we provide resources to the governments? Okay. They don't care about people being sick, people having to move, people losing their mortgages, people losing their rent. We can't get a job. We're going to be evicted from our apartments. Oh my God, we can't go to school. The church is not open. They don't care about that. Dr. Fauci does not care about that. Dr. Teachers does not care about that. What they want to do is focus on the here and now. We've got 1 million people affected with COVID-19 virus, okay, disease. We got 1 million people affected with this disease, okay? We got 200,000 people dying right now. We need to focus on who is alive and who is dead, and how do we adjust the rest of the world population to deal with this. These other little bitty symptoms, these other little bitty illnesses like, oh my God, I can't go to school. What do I do? Or I can't get a job. Or I'm literally, it is that serious. Literally, this is a life and death situation. It is literally that serious. So any little bitty issues like Black Lives Matter, that's not the main focus right now. And it can be the focus if you want it to be, if you make a big and loud enough statement. If you holler loud enough, you can actually take the focus of the government off of COVID-19 and actually put it on Black Lives Matter. You can definitely do that if you want to, but at the same time, they will draw you a little back, call the federal troops, and make sure everybody in that single crowd is wearing a mask because this COVID-19 coronavirus is a global wide world epidemic. Okay. Why is it global this time? Why is it just not a normal flu season? Why is this not just a normal? Well, this is normal. This is normal. This is, you know what I'm saying? It's a flu season. Why did it get out of control? Do you know what I'm saying? Why did it get out of control? Do you understand what I'm saying? Like, how did the normal flu season that started in October and ends in March? Do you know what I'm saying? It starts in October and it ends in March. How did it get out of control? Like, how did this really get out of control? Right here, I'm looking here on the Washington Post. Okay. This is a July article, July 17th. But the virus cares not. It is relentless and advancing. Either strong action is taken now or the crisis will become much worse. Now, that was July the 18th, okay? Okay. So what does this mean? The whole world, pretty much, this flu strain, 2019-2020 flu strain is stronger. So you have to understand the difference. You have to understand the difference between the normal flu strain, okay? The normal one, which is October through March, okay? So right now we've already got through March. Now we're already into August. This was actually supposed to stop about mid-February, late March. But now we're going all the way into October. Okay, it's almost a year. It's pretty much almost already over, and we're still dealing with almost. What was that number that I gave you guys earlier? What was the number? 19 million people affected with the strain of the COVID-19 virus. 19 million people infected. 19 million people affected all around the world with this virus. 19 million positive cases and over 300,000 people dead. Okay, so we have to figure out why is our bodies, are the normal rhythm pattern of our bodies not able to adjust to the strain of the flu? Why is this flu stronger? It doesn't have to necessarily have to be, but why is it stronger? And that's what we need to address the issue. Because yes, there's a difference between this virus, this your COVID-19, and the regular flu. The regular flu, easy, 3 to 5 days. Theraflu, lemon water, pretty much check your temperature, check your breathing patterns, you're okay. That's the normal flu. But this COVID-19, this coronavirus, it has reached to levels where automatically 3 to 5 days you get pneumonia shock, you're in a coma. And that is what we need to address. That is the issue that we need to address. Okay. Why are people going into comas from a normal strain of flu? Is it a terroristic threat, or is it just a normal pattern where the flu is reaching to a higher and higher level than people have ever thought before? And we really need to figure out the issue. Why is it out of control? Absolutely. It was from the Washington Post, July 17th. Okay. So, like I was talking about before in my previous video, okay, the main issue is just like any other disease, worldwide disease, disaster of war, somebody just died, a famous celebrity, a famous world person just died, or there's a terroristic threat. What's the main issue that needs to be addressed when there's any kind of global issue, global problem? Everybody just lost their jobs all around the world. There's massive evictions around the world. There's major issues going on around the world. What is the main issue that needs to be addressed? What is it? Communication. Communication. That is the main extremely important because if people will stay up all night from 1, 2 o'clock in the morning to know if they have a new president elected into office, why would they do the same to figure out if there's a disease going on around the world and it's coming at their doorstep, their doorstep? If you will stay up all night to watch a basketball game, a baseball game, the Royals, the Dodgers play, why can't you do the same and figure out the statistics of a virus contagion coming soon in your neighborhood? And that's what people need to deal with. Okay, they need to pay attention. And President Trump has been doing these press briefings, but he's tired. He's tired. I'm tired. We're all tired. We're all people. We're all tired. We are very tired. I'm seeing your face on TV every day, but we have to see it until the issue is resolved. And right now, it is literally like a snake. It is moving slowly and it's moving slowly and killing more people. And now in the United States, let me get the current United States. I just had it on my other one. Look at this. This is a mess. I don't have nothing. Oh my God. I really need some more space. I got a lot. There's a lot of opportunities. Yeah. Okay. Hold up. Okay. This is from the Center for Disease Control.gov. They're looking at my breath, literally doing research on my breath. It's evil. It's evil. It is really evil. Okay, so the United States COVID-19 cases and deaths by state. The United States of America. Here we go from the Center from Disease Control. Okay, there we go. Cases right here from the Center from Disease Control. Total as of January 12, 2020, 21st. The USA, this is updated or no? As August 8th, updated August 8th to today. There is a total confirmed of 4,920,369 total confirmed positive cases of COVID-19 coronavirus. So far, 160,000 people have died. And cases per 100,000 people, that means out of 100,000 people, like in a city, in a normal city, this is what it's trying to say. In a normal city of 100,000 people, which could be it's a small city. A small city could at least have 1,000 people have died in that city from COVID-19. 100,000 people in a city is a small city. That is a very small city. Here we go. So in California, there's a total cases of 538,000 confirmed COVID cases. In Florida, there's a total of 512,000 confirmed cases. In Texas, there's a total of 474,524 confirmed cases of COVID-19. And New York is number 5. New York is 228,753 confirmed cases. And let me go to Louisiana. Louisiana has 128,746 confirmed cases. In Illinois, Chicago, 191,808 confirmed cases. Georgia's number 6. All the top 5 are southern cities. It's horrible, except New York. Georgia has confirmed 209,004 confirmed cases of COVID-19. Arizona, 185,053 cases. Jersey, 184. North Carolina, 132,000. Massachusetts, 120. Pennsylvania, 117. Connecticut's right next door to Massachusetts. Look, 50,000 cases. New Mexico, 21,000. New Mexico's in the south, 21,000. Maine, 4,000 confirmed cases, because it's the climate. It's the climate. See how the climate of a city changes the people are adjusted, their bodies are adjusted to it. The Virgin Islands. Is it what I'm talking about, people in the islands? I don't even want to say. I don't even want to say. I don't even want to say how many people confirmed in the Virgin Islands with COVID-19. Virgin Islands, 528. American Samoa, confirmed cases in the Samoan Islands, 0. Palau, confirmed cases in Palau, 0. The Marshall Islands, confirmed cases in the Marshall Islands, 0. Guam, the confirmed cases in Guam, 411. Hawaii, confirmed cases in Hawaii, 2,000. Alaska, 3,000. See, it's just the cases, the climate, and people are pretty much adjusted to it. And it's a healthier climate too. But hot weather doesn't necessarily mean you're better, because right here, Florida is number 2 right now with confirmed cases. So just Florida has a climate as the Virgin Islands. You know what I'm saying? It's a smaller population. Okay. Less people travel. Okay. Look, I thought I had my stuff together. Okay. So pretty much what we have to do, okay, right now, like I said in my previous video, There has to be clear channels of communication. Seriously, seriously. If the commander in chief in Washington, D.C. and his coronavirus task force says one thing, and Governor Andrew Cuomo of the biggest state in the United States says one thing, and Governor Greg Abbott in Texas says another thing, and Andrew Newsom, Greg Andrew Newsom in California says another thing, and the other governor in Florida says another thing, they have to be on the same page. Okay? They have to be on the same page, on that same level, literally on that same level. Because if there's any kind of differences blocking people from communicating, that is where there's going to be more deaths and more spread of the disease. Because the channels, if we have this age of technology, internet, Facebook, Instagram, we have to get the channels across to let people know what is going on. And you literally have to walk down the street and ask people, what does coronavirus mean to you? Do you have any family, anybody infected? What does it mean to you? What's going on? Oh, blah, 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 blah. Oh, really? Okay, well, thank you. That's all I need to know. You have to get the key clear as day. I mean, if you want to pronunciate it as much as you can pronunciate it as much as you can, but it's still going to remain the same. Okay, it is still going to be the same issue. It's the same thing. COVID-19 is here and it is killing people by the droves. Now, we thought we got rid of it in New York and Jersey in February and March, in April. Literally, literally. Like Governor Andrew Cuomo had his last briefing, his last desk briefing in June. Governor Andrew Cuomo was like, okay, this is my final desk briefing of today, July 1st. Governor Andrew Cuomo was like, this is my last desk briefing. I will not be doing no more COVID issues, COVID talks, no more. July 1st. Here comes June 30th, June 15th. Bye, Governor Andrew Cuomo. Bye, Governor Andrew Cuomo. Guess what? He's still talking about it. And I know he's tired. He got his whole team together because he's still talking about it. Now, on top of COVID-19, guess what? New York is going through a normal summer power outage. New York has to go through a citywide power failure on top of COVID-19. People lining down the streets to get tested for COVID in the regular neighborhood clinics. Now they can't get tested because there's a power outage at the clinics. There's no generators. The whole city's on shutdown for like 5 days. So they just Blasio just reopened New York about, what's today, Saturday? They just opened it on Thursday or Friday. Friday the 6th. Oh my God. Friday the 6th or 7th. Okay. So again, it takes time. It won't happen overnight. Okay. But these confirmed cases right here from the CDC, from the World Health Organization right now, currently, as of 12:15 p.m., August 8th, California, the highest, is one of the biggest states. It's not the biggest state outside of Alaska, but California still is one of the biggest states. It has 538,416 people positively infected with COVID-19. What does that mean? That means 500,000 people have coronavirus in the state of California. Guess where most of those people are at? Guess. They're not near Vegas. Guess where they are? Guess where those 500, guess what half of those 1,000,000 people infected with coronavirus are in California right now? LA. Guess who also is in LA? Hollywood. Thank you. That's why Hollywood is actually being infected positively by COVID-19. And you know what? They are not going to report it to the press. They are not. Oh, no, they won't report it. Maybe in New York they will, but in California, they will not report it to the press for the sake of their careers. For the sake of their careers, they cannot report it to the press. They cannot report it to the press. They can address the issue, but for the sake of their careers, they cannot let people know that they have been positively not had contact with somebody, but they have been infected with COVID-19. Can you believe that? I'm a $1 million Hollywood actor, and I can't tell people that I have a virus, a viral infection. Why? Because I want to be healthy for my job, for my next acting job. Guess who also lives in LA? Atlanta. A lot of Atlanta people live in Los Angeles. They go back and forth between Atlanta, Los Angeles, Los Angeles, Atlanta, Atlanta, Los Angeles, Los Angeles, Atlanta, back and forth. The movie industry, the movie industry. I mean, New York, yeah, LA, New York, definitely, but a lot more film studios are now being produced in Atlanta and Miami, Miami, Atlanta, LA, LA, Atlanta, Miami. What does that mean? Guess the next state. Guess the next state that is affected with COVID-19 virus. Florida. 512 512,421 people infected with the COVID-19 virus positively in the state of Florida. Guess where those people are in Florida that have the positive virus? Guess where they at? Miami. Miami. Where else? Orlando. Where else? West Palm Beach. Where else? Fort Lauderdale. Where else? Fort Myers. Where else? Daytona Beach. You see how that works? You see why it's getting worse? Because it's the virus is getting worse because people are going back and forth for the sake of their careers, for the sake of their livelihood. They have to work. They have to survive. And if they have to survive, that means who cares if they have a virus or not? They have to do what they have to do in order to eat. They have to eat. And if they have to travel back and forth between Miami, Atlanta, and LA, they have to do it. As soon as all these celebrities, all these people going back and forth between Miami, Atlanta, LA, Atlanta, Miami, Atlanta, LA, Atlanta, LA, Atlanta, Miami, LA, Atlanta, Miami. Guess what? It's causing the virus to spread. It's causing the virus to spread. And these are not poor people that have this virus. They are very rich and affluent people. Because usually the poor people, it's not reported because they don't have access to the testing sites. So the people that have access to the testing sites and the people that have access to be reported are people that can get transportation to these sites to be tested and confirmed positive, or get access to hospitals. Usually, most of the time, they are middle class people. They can get access to transportation. Most of the people, especially in upstate New York, they have to literally have somebody go door to door and ask them, hey, grandma, hey, grandpa, you want to go to the hospital and get tested for the flu? Honey, I don't want to do that. Yes, it's an issue. The poor people are not going to be heard. They're not going to be reported. Are you guys hearing me? Are you guys hearing me? I'm not making a general statement about it. I'm actually telling the truth. Because right now it's being published that more Black and Latino people are being affected by the COVID-19 virus. Why? Because they don't have access to the resources to get there, to the testing sites, and to get there. And what does that mean? That means that more people are infected with the virus, and the health department does not know about it. Why these more people? Because they're Black and Latino, they're minority, they're colored. They can't even count the numbers. More Black and Latino are infected because it's not being reported. It's not being reported. It's not being reported to the press. Who cares if more Black people have it? Okay, Black people, Black and Mexicans have the COVID-19. How? Wow. Wow, that's great. How many? We don't care how many. We just know we want to know Black and Latino people have it more than anybody else. This is really sad. I can just walk right down the street and get tested. A testing site's 10 minutes here in downtown Boston, but if I go to a city like Dallas or Houston or San Antonio, guess where I'm going to have to go to get testing for COVID-19? I'm literally going to have to, if I live in the suburbs of Houston, I'm literally going to have to drive an hour and a half out in Houston to get tested at a CVS. Or if I'm in New Orleans, where can I go get tested if I'm in New Orleans or Baton Rouge? Or if I'm in Pensacola, Florida, where do I get testing? There's no testing site in my retirement community. There's no testing site in my neighborhood. They're all immigrants. We don't even know where the closest hospital is 20 miles away. You see what I'm saying? A lot of Cubans, a lot of Puerto Ricans, a lot of immigrants, Haitians in Florida, a whole bunch of island people in whole. It's a mixture of people in Florida. Haitians, Puerto Ricans, Cubans, Italians, so many different mixtures of Florida. Do you speak English? Where's the nearest hospital? And that's another issue. Language barrier is also another issue too. The language barrier is also another issue. Okay, so I'm now into an hour in my conversation. Again, there is a lot of things that need to be addressed by the current administration, and the main thing that we can do is make sure that we have clear channels, clear access to communication. Communication has to be fundamental and it has to be clear. Now, it's great to have people like, Commander-in-Chief to talk about it. It's great. Andrew Cuomo, great, great. Newsom, Abbott, who's the governor in Massachusetts? Charlie Baker. That's great. But they need to get it down from the higher level and bring it down to the low level for people to actually really understand what is going on. They need to take it high and they need to bring it down low because it's spreading, but it's only on the upper administrative level where people, they just want I mean, what if you don't have access to a TV? How do you know what's going on? What if you don't have the internet? What if you don't have a smartphone? How do you know what's going on? Okay, so that's another issue. It needs to go from a high level and bring it down to a low level for people to really understand what is really going on. Okay, because right now it's just way too much administration, way too much higher upper administration controlling the ropes, controlling the money. People, I literally took me 6 months to get my first stimulus check, and people got it last year. Got it in January. You know what I'm saying? January, February. And it's August, and I finally got my first stimulus check. You see what I'm saying? You see me? So they need to bring it down from a high level to a low level because now you're bringing it from more affluent people to the low class people. And when it hits the lower populations, it's going to start killing people off. And they're not even going to be able to count how many people are dying of the disease. That's just a normal pattern of life. It's just normal. There's no generalization about it. It's normal. Okay. So people are quarantined. Quarantine is great. Hey, quarantine. All right. I'm looking here at the Boston Chronicle. Are they doing a thing today? That's great. Oh, okay. What's the first confirmed virus of West Nile virus is being confirmed in Massachusetts. Governor Baker delays next reopening step, cuts maximum size of outdoor gatherings in half. Because school's about to start. Sex offender charged with rape, bailed out of jail, facing new rape charges. Okay. Here we go. New Hampshire church event attendees may have been exposed to COVID-19. $320 new confirmed COVID-19 cases confirmed. COVID-19 cases, 18 additional deaths. 111,000 confirmed cases in Massachusetts. 390 patients with coronavirus hospitalized. I got to get Airbnb tonight. Okay, so again, we got to make sure that there is, especially right now, presidential elections coming up. The economy is horrible. People are losing their homes as well as their jobs. But beyond all that, beyond the president, yes, we still need to focus on the presidential election. That is great. But the main issue that needs to be addressed beyond anything, beyond deaths, beyond anything, it needs to be clear communication against every single office. Every single office. Literally, every single office needs to have clear communication, making sure that the people and their families in their neighborhoods, as well as on the higher administrative staff, with the governors, the mayors, the congressmen, senators, representatives, they got that already under control. But they need to bring it down a level. They need to bring it down a whole nother level. They need to bring it down a level. From that level, from the TV media, from the middle class, okay, from the college students, then they need to bring it down to another level for the low income people, for the nursery schools, for the daycares. Do you see where I'm going here? Because they need to bring it down a level because people are still not understanding what's going on. All people really on the street, wear a face mask. That's pretty much about it. New Orleans, Florida. Florida's not abiding by face mask rules. Los Angeles is not going to abide by face mask rules. Right, because it's Hollywood. People got to put on a face. People got to wear a mask. They got to make money. You can't make money with the mask unless it's fashion design and you use it for fashion. But if you're in Hollywood, you got to have face. Okay, I got a job to do. I got to be at this place at this time. You see what I'm saying? So if there's more cases confirmed in California as well as Georgia and Florida, please believe it is Hollywood involved. And where there's Hollywood involved, there is business. That is money. That is the movies, that is TV, national television, and that is worldwide news. Okay? That's films, that's production, that's TV, that's media, that's communication. And usually, if Hollywood does not want to address the issue, then that means it's a political issue involved. There's other things going on involved, especially if Hollywood does not want to talk about it. If celebrities do not want to talk about other celebrities, do not want to talk about it, but other celebrities are, then there's something usually most importantly going on, especially if it's Hollywood related and Hollywood doesn't come together and address the issue as a whole, pretty much as history tells us, okay? It can be politically involved. Okay. So again, we have to address it. You can generalize it as much as you want, but you have to have common sense after common sense. There are going to be more cases involved. More people are going to die. It's the natural pattern of life because the disease has to die off naturally. It has to die off and progress off naturally because it is the body, the human body. You can't just get rid of anything overnight. It doesn't. When you have gastric bypass surgery or when you have a nose job, you can't just recover from a nose job or from a major surgery overnight. It doesn't work that way. It takes time, outpatient recovery, physical therapy. It takes time to naturally let your body naturally digress down from a surgical surgery, from a surgical enhancement. Okay? So if your body has to adjust to a change in surgery, or even if you had your gallbladder removed, if you had your tonsils removed, your body is still going to have to adjust naturally. Okay, you just lost your tonsils. You had a root canal. Okay, you have to recover from that pain naturally. I mean, you can take medicine. Medicine's great, but again, your body has to recover from the pain naturally, from the disease naturally. It's a natural progression. Anything other than natural, any other quick recovery, quick methods, it's not going to work, because you can recover from the symptoms, but the disease, the virus, is still going to be dormant in your body. And give it a week later or two, you're going to go through the same thing over again, but it's going to be in a worse level, and the symptoms are going to double up. That's what happens when the flu happens. If you don't go home and rest, your body's not going to be able to recover fully from the normal regular seasonal flu. Okay, so we have to let our bodies rest. At the same time, though, to let our bodies rest, it doesn't mean that we don't do anything at all. We don't sit at home and not do anything. Okay, so again, we have to address this on a natural level. To rest doesn't mean to not do anything. Okay, you can still let your body rest. You can still drink fluids. You can still take vitamins. You can still eat on a normal pattern of life. Okay, eat healthy. Let your body rest. Sit, exercise, do some yoga, do some kickboxing, do some exercises at home, and still at the same time, though, you can still be working. You can still have clients come in, see you. You can still do clients over the internet. You can still maybe have 1 or 2 clients a week to come in to see you, and make sure you know who they are and where they've been. See how that works? Okay. Okay, because until the natural flow, the natural pattern of this virus subsides, okay, it's going to take maybe about a couple more months for it to naturally die off. Okay, so the flu season, like I said before, the flu season usually ends in, what was it, March, and now it's been going on for almost a year now. This global epidemic. Now the global epidemic, coronavirus, has to deal with the influence of the new regular flu season coming in. Okay, so now the COVID, the symptoms of this comatose, do you know what I mean, pneumonia virus, now it has to deal with the natural progression of the normal flu season. A couple coughs, a couple allergies, maybe a fever here and there, but now people are not as comatose, and now they don't have full-blown pneumonia as they do with COVID-19. You see how that is? So now the body has to adjust. Okay? And now when the COVID-19 virus hits the normal seasonal flu, then it will become balanced. And that's probably what Dr. Fauci and Dr. Teachers have to figure out when the normal flu season comes into pattern about October, late October. Guess what else happens in late October? The presidential election. So are you telling me that the COVID-19 virus will end when we have to elect a new president? Obviously. So is this a political flu? No, it's not a political flu. It's not a political coup d'etat. It's not Trump. It's just a normal rhythm flow of the climate. It's normal. And then next year we'll have another issue. And then the year after that we'll have another issue. Now it could have been a political coup d'etat from China, because Trump always calls it the China virus, the China disease. And China may have got tired and said, we don't want no more of you, Trump. Okay, but no, but again, understand it's a normal flow. There's a normal flow progression of life. It's a normal flow, a normal progression of life. So please be careful, guys. Okay? Understand the difference. And people down south, they understand the difference. They know the difference too. Oh, this is a normal flow. Yes, it's normal, but it's a little bit different this time. And when you go and you talk to elderly people, let them know, yeah, we want you to get tested, grandma, grandpa, but it's a little bit different this year. The flu season is a little bit different this year, grandma, grandpa. That's why we want you to be careful. It's a little bit different. It's a little bit stronger. Okay? So be careful. All right. Okay. So again, understand when the flu season hits, I wrote this down. Everything I write down is like disappearing. There we go. And yet there will be other cases of violence and crime on the increase because of COVID-19. People are now they're staying indoors and now they're going back outside. So there's going to be increases of cases of domestic violence, rape, sexual abuse, child abuse, because people are indoors all the time and they don't have the opportunity to report it to the police. Okay, because everybody's now being quarantined, being isolated. And when people are isolated, that leads to an increase of domestic issues. Okay? Child abuse, domestic abuse, a lot of other issues, as well as prostitution is way extremely on the rise. Now, I'm not trying to justify myself saying I'm better than anybody. I am not better than anybody. But if the government is shut down, if the schools are shut down, if unemployment is on the rise, you best believe that every single person will find any opportunity, any other kind of hole in the wall that they can to get any available resource. And they will use anything and anybody to make money. And yes, it is very sad. It is extremely sad. It is extremely sad. So you've got to be really careful. When a country's economy, people telling me this all the time, the queen, be wise, be wise. What happens when a nation's economy is reliant on prostitution? What does that mean? That means something going on in government. Government is out of control. When prostitution is the only method of work, only method of survival, that means something is going on in the government and the leaders. If your only way to survive is through prostitution, that is an issue. And your next door neighbor, and your neighbor down the street, and your pastor, and your friend, if their only means of survival is through prostitution, that is an issue. And usually when prostitution comes in, when sexual abuse is reported to the press, any kind of sexual abuse, whether it's child abuse, domestic violence, if any kind of abuse is being reported to the press, that means it's already on another level. And the press has just been exposed to it on this lower level. That means it's already on a higher level that the government does not want people to know about. If it's already been reported to the press, that means that it's already been in existence 6 months past. And right now, people are actually finding out right now in August 29th, 2020, the Jeffrey Epstein case. And guess what? Jeffrey Epstein committed suicide 6 months ago already. He committed suicide 6 months ago already. Now we have his girlfriend. What are we going to do about her? Now, because he committed suicide, now she's his only survivor, okay? His heir. So we have to get out of her some way or another. Guess who else was involved in the Epstein case? Now you have royalty being involved. Okay? So it's another issue. Other issues, okay, about prostitution. There's something going on in government. It's a natural flow of life. Something's going wrong in the economy. Guess what else is going wrong? Guess what else? Natural. We're losing our monetary supply. The US Mint, we're losing our US Mint, our resources to produce coins. And so usually when prostitution is the only method of survival, it doesn't necessarily have to be about anything about physical money. It's all about bartering. I'll give you this if you give me that. I'll give you this if you give me that. It's the tit for tat system. Tit for tat. Tit for tat. Tit for tat. Tit for tat. Quid pro quo. It's all lawyers' issues. It's really sad. And most of the time, prostitution does have to do with money, or it doesn't. It's really sad. It is really sad. When it's really sad when the whole economy of a U.S. government is reliant on prostitution. All you have to do is no. There's other ways to barter with people. There's other ways to barter. There's other ways to barter. Yes, there is. But again, a job is a job. And you have to way to figure out some way to make some kind of exchange. And like I said before, prostitution doesn't have it most of the time, it doesn't have to do anything with money, physical money at all. It doesn't have anything to do with a physical money at all. It doesn't necessarily have to do anything with physical money. You don't necessarily have to pay somebody in cash. You could pay somebody other ways. I want a real defined term of prostitution for you guys to understand what is really going on. Here we go. Britannica.com to figure out what is really going on, to really actually open up your eyes. Prostitution is the practice of engaging in relatively indiscriminate sexual activity, in general with someone who is not a spouse or a friend, in exchange for immediate payment in money or other valuables. Okay, so it says right here, it says you're engaging in sexual activity in exchange for immediate payment in money or other valuables. Okay, so if the whole economy is reliant on prostitution, that means that that our government is losing our something very valuable to us. Very valuable. Very valuable. More than gold, more than United States reserves. You have to have common sense. If everybody in your neighborhood, if your church is shut down, if the schools are shut down, if your job is shut down, we can't return to. If the restaurants are shut down, the restaurants are closed down, and your only way to survive is through doing something between you and your landlord or surviving on the streets. That is an issue. And most of the time, you go up to that person and ask you, "How can I service you today?" "Oh, I just need this and that." Most of the time, they give you money or they'll give you something else in return. Okay. So it always has to do with something that is valuable. And right now, what's valuable in the economy is what's valuable? I need to pay my rent. What else is valuable? What else is valuable? Kids. What else is valuable? I need a place to stay. What else is valuable? I need water. I need food to eat. Literally. You have to figure out what is valuable to different people. What you value may be different from what I value. So what you may value is I need a wife at home to take care of my kids. This person may value I need some space and time to myself. This person may value I need to go to college to finish my degree so I can go back and take home and open up this business. Or what this person may value, I need 100,000 votes in order to run for office. Or what this person may value, I need about 10, 15 minutes to speak to you right quickly in order to get this government grant. Okay, so people value things at the same time. People value children, people value time, people value places of worship, people value fashion, people value relationships, husbands, wives. People value things every time on a different level. What you may value may be completely different from what I may value. Now, right now, I'm in survival mode. Okay, so what I value is completely different from what you have normal every single day is normal to you. But for me, I'm on survival mode, as well as for other millions of Americans. I'm on survival mode. I need a place to eat. I need food to eat. I need a place to sleep, and I need food to eat and a clean bath. I'm on survival mode. And I'm a survivor of domestic abuse. So what does that mean? I'm a survivor of domestic abuse. That means I have to be very careful where I sleep, what shelters I go, as well as who I come into contact with every single day. Okay? So what I value is different from me as well as different from you, as well as I'm in the medical field. So as a medical professional, on top of everything else, I have to always be in demand, as well as it is mandated by the United States government. If you are a health official, you have to be working, or else they will put you in jail. It is mandated by the United States government. If you have a health, any kind of health or medical license, or if you are an essential worker, you have to be working. And people will ask you, are you working? What are you doing? Are you working? And literally, if people know you are in the medical field and you are not working, they can find some way to get you arrested. They will find some way, somehow, to find some way for you to have a great, nice conversation with the local police department. If you have the certifications, if you have the credentials that the public needs, and they know that you are sitting at home on your little bitty butt and not working for the community, you best believe people will find some way for you to enjoy a nice, cozy seat in the county jail. You have the credentials. You are part of the community. The community needs you. You are an essential worker. And people go up to me and ask me every single day, are you working today? Are you working? Well, I mean, like, what do you mean? Am I working? Am I working? What do you mean? Am I a prostitute? That's not. Some people mean that, but some people mean another thing. No, no, no. It doesn't necessarily have to mean are you a prostitute? It means we need your help. It means we need your help. We need you. Are you working? Am I working? Working where? What do you need? You have to ask questions, because usually people, especially if it's a medical issue, people are not going to come out and out to the public and say, "Oh my God, my grandpa had a heart attack. Can you help me?" People won't say that. Right now, people are very, very secluded and isolated. People will not tell you, "Can you help me? I cut myself. I bruised myself." You literally have to go right up to people and you have to ask them. They have to ask you, "Are you working today?" And you have to ask questions. Ask questions. Or you could be sued, or you could be put in jail. If you are a medical professional and people walk right up to you and they ask you, are you working? They could sue you or they could put you in jail. And if at last resort, people need your help and you are nowhere to be found, at the last resort, they could shoot you. Because people are that desperate. We need help that bad. And you are not around, you are not available. We need your help right now. What are you doing? And why are you not working? Where are you and why are you not working? It's, and on top of that, you have military experience and you're in medical field. Why are you not working? And it doesn't necessarily have to do with anything about prostitution at all. Like I said before, here in Britannica.com, in the Britannica dictionary, you want me to go? I can go. How many dictionaries do you want to know that prostitution doesn't have anything to do with money? It is ooh, it is really that bad. It is really, really low. It is low, and people are scared for their lives. And now it's going down south, and people are extra, extra scared. I'm going to go to you guys one more time. Okay. Thank you, YouTube. Thank you, YouTube. Thank you so much. Thank you, Sanjay. Literally, people are that desperate for medical help. They are desperate. They are desperate. They don't even know what's going on. Why is everything shut down? Okay. If everything's shut down, guess what's going to happen next? If we can't get the help that we need, if people can't, If people cannot get the help that they need, guess what's going to happen? They're going to start shooting people to get the help that they need. And especially if you're not working and people know people need your help and you don't want to help them. Okay. Thank you, YouTube. Thank you, Regis. Thank you, the Lord Jesus above. All right, here we go. I should actually be looking at this myself, because we have to make this. You have to make this well known. Okay. There's a lot of other issues going on. Okay, but you have to be available for services. COVID-19 is here. Okay, that's a fact. That's a fact. That's a well-known fact. Action, place, or thing. It's a fact. It's a fact. It's here in the United States. People are dying in the world. People have been affected. It's known. It's physical. People have the symptoms. It's physical. It's real. It's not anything to fake. It's real. It's here. Now we have to figure out, what do we do about it? Okay. People are desperate. And when people get desperate, they will do anything. Especially when it comes to being evicted from their homes. They will do anything to keep their homes. Okay, here we go. Prostitute, a woman who engages in promiscuous. This is from the Merriam-Webster's dictionary. Old. Okay, look. Okay. To offer indiscriminately for sexual intercourse for money, to devote to corrupt or unworthy purposes. Okay, to debase somebody. Okay, prostitute, devoted to corrupt purposes. Okay, devoted to corrupt purposes. Okay. Or it could be a woman who engages in promiscuous sexual intercourse for money, or whore. A male who engages in sexual practices for money. A person as a writer or painter who deliberately debases himself or his talents as for money. Okay. The act or the practice of indulging in promiscuous sexual relations, especially for money, the state of being prostituted, debasement. So usually when you debase somebody, that means you lower them you put them on a lower class. Okay. Now that's the definition for the Merriam-Webster's definition of prostitution. I'm going to go to another definition of prostitution. Let me see where it's. I'm gonna give you another definition of prostitution right here. And it's not escort. Okay. It is not escort. All right. Thank you, YouTube. I gotta get out. Okay, now it's also a definition of prostitute right here. I'm trying to break it down. Oh my God, God is so good. Thank you. All right, so prostitute, statute. Okay, let me write this down. Okay, because the economy is changing right now. People are kind of a little bit blind. Obama staff. Pastors of South Dallas. Hey, y'all know who y'all are. All right, okay. Thank you for a revelation. And I need to get some eat. It's lunchtime, and I need to get a place and chill. All right, prostitute. and I need to get out. It's a beautiful day, you know what? But hey, gotta focus. And I need to be like, seriously. Okay, I'm just going to go there. Okay. People know where you are and they don't know you're working. Oh, yes, they will. Oh, yes, they will. Okay, let me see. Here we go. Let me break this down. Merriam-Webster. Cross. People do this all the time. People do. I'm sure they do. I'm sure they do. Because you know how the queen is. You got to break it down. You got to break it down for me because I am dumb. You got to break it down. Because the economy is changing. People are changing. COVID-19 is getting worse. It's not getting better. And Andrew Cuomo is getting tired, and he is getting old of being on TV every single day at 12 o'clock to make his little bitty announcement, COVID rates, blah, 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 this, COVID rate, blah, blah, blah. Okay, Andrew Cuomo, we love you. We love you, cutie hottie, patootie, Governor Cuomo. We love you. We love you. It's a beautiful day. Yes, it's a beautiful day. But COVID's still in the air, Governor Cuomo. People, hey, Brooklyn. Yes, exactly. Exactly. That's what I'm talking about. They were talking about this earlier. COVID-19 is on a second wave. It is. It's a second wave, and more people are dying, just like this, just like the swine flu, the chicken flu, the bird flu. Because the normal the normal flu season is, between October and March. And when the normal holiday season comes in, it's going to start trying to compete with the normal flu season versus the normal, this COVID, whatever corona mixture, super flu, tornado flu, whatever it is. Okay, it's going to have to compete with this normal tornado flu. Okay, so you have the regular seasonal flu, and then you have this tornado flu. Okay, so it's especially down south. When things happen down south, then it gets out of control. It gets out of control because usually people on the East Coast, when it's in the press, New York, okay, New York people understand this. People are traveling all around the world. Oh yeah, it's normal. It's just a normal travel. It's just a normal flow of travel. Yeah, we understand that people are always coming into the city. Okay, oh, it's just an immigrant. Oh, we understand that. It was normal. But when it gets down south, then it becomes an issue. And then it becomes, oh, it's not just a normal travel flow. Now it's okay. We hate immigrants. Kill the immigrants. Or we hate Muslims. The Muslims brought up. Or we hate the Chinese. The Chinese brought the flu. Kill the Chinese. That's what happens when it goes down south. And I'm just generalizing it. But yes, it can get way more serious when anything goes on a second wave and it goes from the north to the south. And you can literally have anything normal on the East Coast turn into a war when it goes down south. Literally, you can actually create a war just from anything going up north, going down south. You can literally cause a war, literally, a civil war, a civil unrest, a coup d'état. You can literally cause a civil war. It's really that bad. It's really that bad. And now we have KKK all over the streets. It's really bad. It's really, really bad. And when it goes down south, people are actually trying to, take the law into their own hands. Like, we don't want police brutality. And that's in the big cities. But when you have these little bitty kids go down south and talking about we don't want police brutality, that's another issue they need to address. Okay. They need police in Dallas. They need police in Atlanta. They need police in Miami. Can you imagine Miami with no police, no police force? Not in Miami. Not in Palm Beach. No, they need police there. They need police. They need INS. They need everybody in Miami. Okay. So yes, when the second wave come, like right now, like I was talking about in these previous stats. Oh my God, look at this. America under attack. Calvary Cathedral, my church, to talk about America's under attack. Okay, so I'm going to go back to this word in a minute. Okay, but like I was talking about, when right now there's a total confirmed cases of over almost 500,000 people have been tested positive for the COVID-19 virus in California. Almost 500,000 people have been tested positive for COVID-19. 500,000. That's in the state of California. Now you know California, LA, San Francisco, Las Vegas. Then you have Lower California. You have um, San Diego, Southern Cal, San Diego, Santa Barbara, Tijuana. Wait, Santa Barbara's. Wait a minute. Yeah, that's Lower California. Well, LA. LA is Lower California, but it's still central. You have San Diego, you have Tijuana, you have, Mexicali, you have San Bernardino, you have Riverside. That's all Lower California. Okay. But when you start getting to cities like LA, that's when you got that Hollywood money, and they do not want to be involved with anything coronavirus related. If you have a celebrity talk about, I got contacted, pause, I have, okay, you get me? If you have celebrities saying, I have COVID-19, guess how many celebrities that person has been with? Okay, they needed to talk about other people that have had contact, not just normal physical contact, but they've had sexual contact with this person. Okay, and you know what, Hollywood, it's all about money. People don't care. You give me money, I'll pay you. They don't care. You give me money, I'll pay you. How much you want to pay me to keep silent? I pay you $1 million. Okay, it's Hollywood. Lyme disease, tuberculosis. That's still the city. The CDC still has to deal with Lyme disease, tuberculosis, swine flu, bird flu. They still have to deal with that. Yes, they do. They still have to deal with that. Washing your hands is good. Thank you, Tyler Perry. We know how to wash our hands. Yay! But it's more than just that. It's more than just, especially when it's going to hit Atlanta. Here we go. California, 519,427,000. Florida, 491,000. Texas, 451. And back and forth. LA, Atlanta, Miami. LA, Atlanta, Miami. LA, Atlanta, Miami. LA, Atlanta, Miami. Hollywood, LA, Atlanta. LA, Atlanta. LA, Atlanta. LA, Atlanta, New York, LA, Atlanta, New York, LA, Atlanta, New York. If Cuomo lets people from LA into New York, unless they're New York residents, if Cuomo does allow people to come from LA to New York, if he does, if they got the money, he'll let them in. Seriously, in Georgia, 209,004 confirmed cases, total positive cases. The top 5 cities, states that have been affected with coronavirus, top 5. California is number 1. Florida is number 2. Texas is number 3. Texas, 474,524. New York City is number 4, not number 1. New York City is number 4. And guess who's number 5? Georgia. After Georgia comes New York State. After New York State comes Illinois, Chicago. Georgia is number 6. Chicago is number 7. New York State is doing good, and New York City is still low. It's not as high as it was anymore. It's still low. Okay, so again, Massachusetts is like 15. 1, 2, 3, 4, 12. Okay, Massachusetts is 12th in line to positive cases, which is good because it's going down, which is great. So again, like I said before, LA, Atlanta, Miami, LA, Atlanta, Miami, LA, Atlanta, Miami, LA, Atlanta, Miami. Miami, Atlanta, LA. Guess what else is in these cities? Those airports. Those airports. You best believe those airports are major, major, major portals of transportation for a lot of people. Not only Hollywood, but as well as just for major transport transit ports. Okay? LAX, Miami-Dade Airport, as well as Atlanta. People have to fly into these cities every day just to go on an airplane trip. Oh my God, I gotta go to London. I have to go to London. Okay, I live in Chicago, but I go to London. I gotta connect with in Atlanta to get to London. Or I'm in LA, but I want to go to, you know, I want to go to New York. I got to connect from LA to Chicago first before I go to New York. Or you can just do the whole, you know what I'm saying? And so when these people go from these big positive cities, they're also traveling with them. They're not just being in the cities, they're actually going through the transit portals. Okay. So yeah, that's normal. That's normal. And so the airports also have to be concerned. And Dr. Fauci, as well as Dr. Tedros, are not really addressing these issues. The ports authorities, they're not addressing the ports authorities at all. At all. They're not talking about the airlines at all because they don't want people to get extra scared. They don't want people to get, I got my Stevie Wonder. Governor Cuomo is not, how did coronavirus spread, Governor Cuomo? How did coronavirus spread? Oh, it was because some immigrants came from China to the United States. How did these immigrants come from China to the United States, Governor Cuomo? Oh, they flew on a plane. What plane was it, Governor Cuomo? No, they're not going to talk about that. No, they don't want people to get extra scared. Okay. Extra scared. Oh my God, we can't take the airplane no more. We can't go on an airline flight. We can't go on a flight anymore. So yeah, that second wave has to be controlled. They have to deal with TSA. They have to deal with the FBI. They have to deal with Department of Domestic Terrorism, Department of Homeland Security when you get to the airports. So if it's controlled in the airports, then it must be coming from some other method of transportation portal. If it's not the airports, then coronavirus must be coming through some other way. If the airports are clean and it's not coming through the airports, then how else is the virus spread? You understand? So they had to be careful of every single port of entry to a major city, American city. That these officials, when it goes from the top level to the bottom level, they have to be very, very well informed about what's going on, Mr. Brooklyn, I3 Brooklyn 718. So yeah, you have to be very, very cautious about what's going on. Okay. Especially because Cuomo does, I mean, he talks about the Port Authority a lot, okay? But the Port Authority has to do a lot more with more than just seaside. It has to do with trade, okay? So how are we going to be able to get our food across? How are we going to be able to transport our food? Oh my God, we need these supplies. Oh my God, we need this metal. Oh my God, we need these seeds. Do you know what I'm saying? We need this cotton. We need this material. And a lot of trade is done the old way. It's done on ships. Okay. So again, there's a lot of other issues that need to be addressed at the same time. Okay, Mr. Brooklyn. Okay. So yeah, there are a lot of other issues that need to be addressed, which Blasio and Cuomo are not talking about. Okay. So there's other methods of trade involved. Okay. Transport is involved. Okay. You have air transport, you have auto transport, you have sea, transported by sea. What else can be transported by sea? Drugs. There you go. Drugs, cocaine, heroin. And yes, there is a rise of crack cocaine on the streets. Yes, there is. That's another issue with what's going on. People have to figure out a way to make money because they're not being employed by their job. So what are they going to do? They're going to start selling drugs again. You right. You damn right. You damn right. There is a rise of crack cocaine, heroin on the streets. Yeah, there is a rise of it. Yeah, the celebrities from the 80s are coming back. Yeah, guess what else is coming back from the 80s? Crack cocaine. So again, it's a second wave, but I am really overgeneralizing it. But we still have to be a lot more cautious of what's going on. Okay, when it goes down south to these southern states, okay, I'm way overgeneralizing it. But again, we have to know, we have to be a little bit more cautious. Okay, because usually when it's down south, there's uh, as a fact, I'm not generalizing it. I'm not generalizing it, but as a fact, of course, we have more celebrities involved. But down south, though, of course, the celebrity, of course, that's normal. But I'm way overgeneralizing. But of course, down south, there are way better medical facilities, medical hospitals, medical facilities are available. In Memphis, you have Shriners. In Memphis, you have the Children's Hospital, Shriners Children's Hospital. In Texas, you have the medical district in Houston. In Atlanta has great hospitals, and especially in Florida, because you have so many elderly people in Florida. They need hospitals, they need medical care. So of course, if the healthcare system is better down south, they have to figure out a way to control this virus, because people are going to start going into the healthcare system. And so if it's affecting the healthcare system, there means there has to be a law. There's going to be more laws mandated to figure out how do we, especially by the Centers for Disease Control and Medicare and Medicaid. Medicare and Medicaid has to figure out a way, how do we address this disease and issue, and how do we properly classify it and diagnose it? What is a proper classification? How do we properly diagnose the disease? Because this COVID-19, it's like there's so many symptoms involved in it. It's ridiculous. You really can't just classify. You can't really just diagnose somebody with COVID-19, because it's just like there's no real ICD-9 classification for COVID-19 yet. There's no real ICD-9 classification for it yet. You can't really diagnose somebody with it. So they have to figure out a roundabout way. Is it just generalized pneumonia, or is it generalized coma, or is it pneumonia due to complications of COVID-19? And that's where you figure out where that COVID-19 comes to play. They have to figure out a way, especially when it comes to all these hospitals down south. They have to figure out a way to properly classify this illness, because you have the generalized flu. That's a normal ICD classification. That's a normal diagnosis. Generalized flu, generalized flu, generalized flu symptoms, normal. But now that we have COVID-19, thank you. Yes, exactly. They're going to have to really lock down the states. Is a test run really not going to like what's going to happen next? Exactly, Mr. Brooklyn. Exactly. But at the same time, though, they're not going to like it. Exactly. Especially in the southern states. Because in the southern states, especially when it gets to Florida and especially Texas, they're going to get real upset. And I'm not talking about the governor, and I'm not talking about Abbott, and I'm not talking about Ted Cruz. I'm talking about his constituents are going to get real upset, especially in Dallas and Houston. And you have that Houston money and that Dallas technology money. People don't know what the fuck is going on. They're going to get real upset. Where's our money? How much money can you do with what and what? And it's not going to be about a virus. It's going to be about, okay, you know what? We need to protect ourselves. Okay? Because you got that Dallas money. You got that Cowboys money. You got that oil money. We the Cowboys. We can figure out a way to get over this. Okay? So they had to figure out a way, okay, you know, we need to go to the hospital administrative staff. We need to go to the hospital administrative staff. We need to figure out a way to help our districts come together and figure out a way to, what is this? How do we classify this? How do we bring this down from a top level to a lower level to make this easier for the nurses and the clinical staff to figure out, okay, this is a symptom from this. This symptom is for this. Okay, you know what? Generalized flu, generalized pneumonia, low level pneumonia, high level pneumonia. Is it a normal cough, or is it a cough with symptoms of other diseases? Okay. Does this person have a normal cough due to complications of diabetes? Or does this person have a normal cough due to complications of stage 4 cancer? Do you see what I'm saying? Is this a normal pneumonia due to is this a normal seasonal allergy? Or is this a seasonal allergy with complications of asthma? Do you see what I'm saying? Like this person has complications of asthma. This person has asthma. They're on albuterol. Okay. So we need to address the issue. If this person's on inhaler and they have asthma, why are they continually coughing every single day? Do you see what I'm saying? Okay, so that's another issue to be addressed. They're going to have the Centers for Medicaid and Medicare Services, as well as the Department of Health and Human Services, which is not headed by Ben Carson, which is another issue that I've got to talk about. Why is he heading HUD instead of the Department of Health and Human Services? Okay, so they're going to have to figure out a way to classify this and make this easy for people to understand, especially when you get down to the Houston Medical District, and when you get down to major hospitals in Atlanta, when you get to major hospitals in Memphis, and especially the Los Angeles Medical Center. Oh my God, the hospitals in Los Angeles. How many? Oh my God, when you get to all those celebrities, they have to have medical care. Mount Sinai, Mount Sinai in Los Angeles. What else? What other hospitals are in Los Angeles? Oh my God. Let me see. They're going to figure out a way to generalize this disease. Oh, yes, they are. They got to figure out a way to generalize this disease. Los Angeles. Okay, yeah, they got to figure out a way. Kindred Hospital. Kindred's everywhere. Good Samaritan. What else is East Los Angeles Doctors Hospitals? Dignity Health. There's a whole bunch. Southern Cal. There's so many hospitals. Keck, children's hospitals in downtown LA. Olympia, LAC Medical Center, UCLA Medical Center. Oh my God, UCLA Medical Center in Los Angeles, California. They are busy from the head to the toe. UCLA Medical Center. UCLA is busy right now. Adventist Healthcare in LA. USC in LA. The VA in LA. Oh my God. St. Vincent's Medical Center. St. Thomas. Good Samaritan. Kaiser has a big, huge research facility, and Kaiser's all over LA. Cedars, Mount Sinai in LA. Parkview, Gateways, Los Feliz, Cedar Sinai. Cedar Sinai right now is very busy. Encino, Huntington, Cedars, again, other Cedars, Beverly Hospital, at Culver City, Avanti, Centinina, Dignity, Valley Presbyterian, Kaiser, Sherman Oaks, Temple Hill, LA Surge Hospital, Providence, Holy Cross, woo, and Mission Hills, Torrance Medical Center. Oh my God, Torrance Medical Center. A lot of low, yes, all of you. It's Providence. I need to eat. Highland Park. I'm gonna eat in a minute. Pacific Cardiology. UCLA, Mount Sinai, Kindred, as well as the VA, as well as all these other local community hospitals in Los Angeles County are going to be very busy. Los Angeles is great for research, and they have a whole bunch of young people there and people from all different cultures and from all different languages. Los Angeles is more than black and white. You have a huge Latino population, as well as a huge Asian population in LA. Huge Asian population. Huge LA huge Asian. Huge Chinese, Vietnamese, huge LAs. Huge Asians. A lot of Asians in LA. Horrible. Valley Presbyterian, South Central, VA, Beverly, Cedars Mount Sinai, Huntington, Cedars Mount Sinai, Encino, Los Feliz, Gateways, Parkview, Kaiser. It's the main three hospitals right now in LA that are extremely busy is Kaiser Permanente and their clinics, Cedars Mount Sinai and their clinics, as well as UCLA County Hospital and all the clinics that are surrounding UCLA. It is crazy. It is UCLA and USC. It is crazy. It is really crazy. Okay. So again, there's going to be a whole nother wave. And with another wave comes more immigrants and more low income populations to come in, especially when you're dealing with LA County. LA County, a huge, 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 extremely poor wealth gap in LA. The wealth gap in LA is worse than New York and Chicago combined. The wealth gap in LA. You have as rich as Mark Zuckerberg and rich. I'm talking about rich money. I'm talking about producer money. Producer money that they do not publish to the press. I'm talking about Paramount studio money. You have as rich as Paramount, CBS Studios money, and then as poor as on Skid Row. That's the wealth gap in LA. Uh-huh. Yeah, 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 yeah. New York was locked down. Yeah, and you should have sympathy, but you know what? People won't know until it actually hits their doors. Exactly. You can't have sympathy, but people will, I need to get somebody. People will not know until they know. They will not know until it comes knocking on the door and they have a cough here, and they have a cough, and then it turns into full blown pneumonia, and they have a fever that's out of control. And also, it's a normal flu bug. No, it's not a normal flu bug. You don't have a fever. You have COVID-19. And you need to get proper. They need to put you on fluids immediately. Oh, it's a fever. It'll die down. No, no, honey. No, yes, yes. People at the beach and they don't even know that they have a full-blown fever. They think it's the weather, but it's not the weather. It's a fever, honey. It is really sad. It is very sad. You won't know until you know. Until you have a full blown fever at 100. I had 105 fever. I didn't even know I was walking. It wasn't walking pneumonia. It was just I had a fever that was out of control. You're able to function, and the next day you have a full blown fever, and then the next day you're passed out comatose. You're passed out comatose on the street. And then when it happens, they can't resuscitate you because you're already unconscious for over 30 minutes. I think it's if you're unconscious over 30 minutes, you're pretty much brain dead. Hold on a second. Sorry, let me get my facts this straight, Mr. Brooklyn. Hold up. Definition of brain dead. WebMD. Here we go. WebMD. Okay, see by Dr. Twain right here. Tawil. What is this? Oh, my internet is slow. My internet is slow. Why is my internet slow? Okay, my internet is slow. There we go. With me. Okay, here we go. So it says when someone is brain dead. Okay, this is Dr. Tawil. Cool. Isaac Tawil, care specialist, assistant professor at University of Mexico School of Medicine. Okay, now this is what Dr. Tawil says. Okay, he says my internet is very slow. Now it's shutting down. I'm gonna get something to eat, I promise. Oh, somebody. My internet is very slow. There we go. Okay, great. All right, so Dr. Ty Will of University of New Mexico Health Medical School. I'm how much people living their best life when the whole world is on lockdown. They selfish at for that real talk. Yeah, yeah, absolutely. Okay. Now it says here, or if the heart has stopped and the brain goes without oxygen and other nutrients, it needs to survive for a long time. Okay, here we go. So when somebody is brain dead, it starts with some sort of devastating neurological injury. Dr. Tawil says that could come in many different forms. They include traumatic brain injury, a stroke caused by a ruptured blood vessel in the brain, or if the heart has stopped and the brain goes without oxygen and other nutrients it needs to survive for a long time. Thank you. Now, when the brain goes without oxygen, yeah, that's when you declare brain dead. Okay, seriously. Thank you. Appreciate it. Okay, so there's another issue that needs to be addressed. That is another issue that needs to be addressed. Okay, when somebody has COVID-19, okay, yeah, they're taking extra precautions. Let me get to a more professional website. Yes, I need, yes, exactly. It's correct. It is correct. And we need to address this issue. Let my little glasses. We need to address this issue. It's completely erratic. Completely. The damage is irreversible when somebody's brain dead. Exactly. Okay, exactly. Now here's from Emory Healthcare Online from Emory. From Emory Healthcare Online, it says, okay, I'm going to read you Emory Healthcare because it's almost into 2 hours already. Okay. Thank you for participating. I really do appreciate it. I really do appreciate it. Okay. So it says Emory Healthcare brain death determination policy is a guiding document for evaluating patients for brain death. In order for faithfully evaluate a patient for brain death determination, all prerequisites for testing must be met, which include identifying a cause of irreversible coma and ruling out confounding processes. Only in this setting can the clinical examinations required be conducted. In the setting of COVID-19, the process of determining brain death presents several issues. Like I said before, it's really hard for these doctors and clinicians, especially these infectious diseases experts and these Department of Health experts to clearly define what the fuck is COVID. Okay, like what is this? We don't know what it is. We can't find what is the motherfucking diagnosis for COVID-19. Right now, right now, in the Department of Health and Human Services and the Department of Health and Human Services and the Centers for Medicaid and Medicaid Services, there is no diagnosis code for COVID-19 coronavirus. There's no diagnosis code for it. So what the doctors and clinical staff have to do is they have to come up with a generalized list of symptoms, and then with that generalized list of symptoms, then you have to put related to COVID-19 or its specifications due to COVID-19. They have to generalize it as much as they can to come up with a globalized, generalized conglomerate of what the symptoms are. So therefore, if we have these generalized list of symptoms, we can therefore determine that it leads to COVID-19. Okay. So that's how you figure out, okay, Dr. Fossey's talking about it, Dr. Tedros is talking about it in Switzerland. Okay. And Dr. Fossey's talking about it in DC. And they're just talking about the government's viewpoint towards it, but you have to bring it down another level for the clinical staff to talk about it. Okay, so the Dr. Fauci, Dr. Tedros is in Switzerland. Austria, and Fauci's in DC. They're dealing with the government's viewpoint. If the government, they're dealing with the money and the resources to get the help they need. Bring it down another level. Now we have it on the community level. Okay, well, we have the doctors and the staff had to figure out what the fuck is the diagnosis, because we don't know. We have so many patients coming in here into our hospital clinics. They're different ages. They're different. They have so many older people dying in it because it is such a generalized tornado of symptoms. It's a corona. It's a tornado. So there's not that much viewpoint of what do we do? How do we critically cross-examine this disease? Okay, it's high fever pneumonia. Okay, we got the pneumonia. Okay, we got the pneumonia. Now we got the influence of a high fever. The diagnose high fever, diagnose cough, a consistent cough. That's another diagnosis. Another diagnosis is persistent cough. Another diagnosis is high fever. Another diagnosis is chest pain. Another diagnosis is let me see. What is another diagnosis? Chest pain. What's another? Persistent cough, high fever, and then after all these generalized, basic, normal flu virus symptoms, now all of a sudden you have the patient 30 minutes later. Now they're comatose on the hospital bed. How the fuck did this happen? How did this? Excuse my language, but how do we have a normal patient with 103-degree fever and a cup of chills, and now all of a sudden they're comatose and on a respirator? Treat symptoms when they only going to go to just pump us up with meds. No, it's not about medication. It's about figuring out what the fuck is the diagnosis. Excuse my French, but it is that serious, because you can have somebody come into your hospital ward. All of a sudden, they can have a normal temperature, normal temperature, 98.6 degrees. But I have been having this consistent cough for the past 6 days, and then they sit in a hospital bed, they relax for at least 10 minutes. And now all of a sudden, their normal temperature, they're still coughing, but their normal temperature goes from 98.6 to 106 in just 30 minutes. Now they're more relaxed. They're so relaxed that they go to sleep. And now, 10 minutes later, that person is out, comatose. There you go, COVID-19. The hospital staff is checking on that person every 10 minutes. Then a doctor, the charge doctor comes in and figure out that patient. They check them and that patient is unresponsive. What the fuck has happened? Who was looking at this patient? Was the clinical staff? Y'all all fired. This patient is unresponsive. Give me a respirator and give me oxygen right now. What the fuck happened? Oh, doctor, we don't know what happened. This patient came here. They just had a persistent cough. They had a normal temperature. We checked 20 minutes later, and now the temperature went up. Okay, so what happened? We don't know. I was watching him like 5 minutes ago, doctor. I swear. Okay, we understand it. But this patient now is comatose. They're unresponsive. We need to do something about it. We need to do something about this issue. This patient is unresponsive. Okay, we need to address why we have patients coming here. Okay, and this patient is not only unresponsive, but they have a history of diabetes. They have a history of high blood pressure. They have a history of heart disease, and on top of that, they're elderly in their 70s. What happens when you have an elderly person in their 70s comatose? That leaves very, very little chance of survival. And so there's other diagnoses, codes, there's other issues that have to be addressed. Like we just had John Lewis, really well-known senator. He passed away. He passed away from complications of cancer. But the influence of COVID-19 came in with an elderly gentleman in his 70s and 80s. He's just now trying to survive stage 3, stage 4 cancer, pancreatic cancer. And on top of that, he has influence of pneumonia and this influence of a persistent cough. That's very dangerous for a cancer patient to be surrounded by people that are continually breathing on him and continually coughing on him. Because you have a cancer patient, and that cancer patient has to be extremely cautious of the people who he come into contact with. Just being a cancer patient, just being a cancer patient, just that by itself. Stage 3, stage 4, just that by itself. You have to be cautious of people you come into contact with. And then here COVID-19 comes in. Do you know what I'm saying? So we have to be the doctors, they really do not know what's going on. And so what happens is they have to have continually community meetings, Zoom meetings, Google Hangout, all these meetings to come together and figure out, okay, here's the symptom for today. Okay, so here are the symptoms. Oh my God, what do we do? What do we do, doctor? I don't know. I don't know. So tell me about that patient. Tell me about that clinical case study with that patient. What happened with that patient? Oh, well, we put this patient on this, and we gave them IV drops of this, give them this IV. This saline with this blah, blah, blah. You know what I'm saying? And the patient was able to recover, but they're still on the respirator for the next 2 weeks. You see what I'm saying? So the doctors have to come together and they have to figure out, okay, this is, and usually what happens if it is, especially now I'm hungry and now I need to eat. My coffee's over, now I need to eat. Okay. Especially, okay, I need to eat. Okay. So especially when it is anything respiratory flu related, that means that the symptoms may be stronger in one city, and this person in another city may have a weaker version of the symptoms. Or the person in the bigger city may already have developed immunity to it and they don't have any symptoms anymore. And that's where it becomes people are asymptomatic. How can you have somebody that is asymptomatic to this disease and 30 minutes later on the hospital ward, they are comatose? No fever, no chills, no coughs, no history of any other pre-existing conditions. And all of a sudden, they're normal, happy, breathing normal, no problems with respirations. And then all of a sudden, 30 minutes later, they're in a hospital ward on a hospital bed, comatose. Comatose on a hospital bed. Okay, so that is also another issue. My nose. Exactly. Thank you, Mr. Thank you. Yes, I'm on LinkedIn, I'm on Facebook, I'm on Instagram, I'm on Twitter, I'm on everywhere. Battle First Aid Responder Services. I'm on everywhere. Everywhere. I'm on everywhere. I'm on everywhere. I'm on everywhere. Everywhere. LinkedIn, yeah. I'm on everywhere. Okay. So that is another issue that needs to be addressed. Immediately needs to be addressed. Because if people are asymptomatic in Florida and they're at the beach every day, okay, do you see what I'm saying? And you have a whole bunch of population of young generation, 25, 35-year-old asymptomatic young people, and then all of a sudden they go to the hospital, and now all of a sudden at the hospital, oh my God, I have a cough. I never knew I had a cough before. Yeah, you have a cough. Why? Because you needed to go into a supervised location and be observed for a little bit to figure out your body has to get out of that clouded beach and go into a more contained area to figure out what is going on. And that young person at the beach, asymptomatic, when they get to the hospital, then their symptoms start to develop. You see what I'm saying? You see what I'm saying? Because they develop immunity only when they're around other people that they are going through the same thing. Like hormones, all their hormones are the same because they develop immunity together. But when they come into an isolated area, then that's when the symptoms start coming out and they don't become asymptomatic no more. Okay? They don't become asymptomatic anymore. Then oh my God, I have a cough. I didn't have a cough all this weekend. Well, you have a cough now. You just didn't notice it before. Oh, I really? Oh, yeah, I did have a cough. I just have a little bit of fever. I just have 100.1 fever. Yeah. Oh, I didn't have a fever. Yeah, because you didn't notice it before. You were at the beach all week. Do you see what I'm saying? So people become asymptomatic. It means it's not necessarily meaning they don't have the symptoms. It just means that they have a lower version of the symptoms, or it's not even there, or they don't consciously know it. It's without symptoms. Do you know what I'm saying? So they actually have to come into an isolated area, usually a isolated, sanitized area, for the symptoms to eventually, for it to become non-existent, for it to become dormant until it becomes actually visualized. Okay, for someone to actually come in there and observe them, test them, do lab tests, all that stuff. Okay, where the simple words, it becomes, now it's not dormant anymore, where it can be actually come out into the open air. Okay, you get what I'm saying? So again, I'm gonna go back to this Emory article. Okay, so it says, first, only in this setting can the clinical examinations be conducted. In the setting of COVID-19, the processes of determining brain death presents several issues in meeting both the prerequisites for brain death testing and in conducting the necessary clinical examinations. Now, first, irreversible neurological injury must be established. This often requires neuroimaging that is consistent with severe brain imaging. Okay, so they need CAT scans, they need MRI scans. Even in the setting of cardiac arrest, someone's having a heart attack, or severe hypoxemia, okay, where a mechanism of injury is clearly established, neuroimaging demonstrating severe neurologic injury is still recommended. Okay, so it's pretty much saying that they still have to conduct an MRI, they still have to do all these tests, even if somebody is brain dead. Thank you. Thank you. So you still, even if somebody is brain dead, that's what Emery's saying. Even if somebody is brain dead, you still have to conduct a CAT scan, a MRI, whatever kind of diagnostic tools as possible to figure out what is going on. Seriously. Okay. Now, second, confounders to brain death must be ruled out. In the setting of multi-organ failure, which is also another symptom of brain death, ensuring clearance of analgesia and sedation can be difficult. So, in order to get somebody on sedation, to do a surgery to sedate somebody that is brain dead, it says right here, it says you have to rule out brain dead in order to give anybody any kind of sedation, anesthesia. You cannot declare them brain dead. You cannot declare them. If you want to give anybody anesthesia and they're in a coma, you cannot declare them brain dead before you administer that anesthesia. Ensuring clearness of analgesia and sedation can be difficult. Additionally, the impact of ongoing metabolic dysregulation contributes to depressed consciousness and must be reasonably addressed prior to brain death testing. Okay, it's called a depressed consciousness. Can be calling somebody brain dead, but now they're calling it a depressed consciousness. Finally, the clinically exam requires apnea testing in the setting of severe respiratory failure or in patients with unstable hemodynamics. An apnea test is unable to be conducted. Further, in those who may be clinically able to undergo an apnea test, the risk of aerosolizing viral particles during ventilating disconnection presents an additional risk. Okay? Like seriously, somebody's brain dead. How are you going to put them on a ventilator? In patients able to undergo apnea testing, a modified approach using a filtered exhalation circuit will be used. In cases where apnea testing cannot be performed, an auxiliary study such as nuclear medicine, cerebral blood flow study, and our transcranial Dopplers are typically utilized to establish loss of cerebral blood flow. Utilization of these technologies requires highly trained technologists to work around an intubated patient for an extended time period. Currently, this is felt to present an unnecessary high risk of exposure to the technician and a contamination risk to the equipment. So you're working with somebody a patient who's brain dead and they have COVID, the nurse clinical staff can get infected as well as the droplets can get on the equipment. So you have to be very careful. Alternative auxiliary tests such as cerebral angiogram, EEG, are not utilized in the Emory symptom and present similar high risk. So it's saying what's recommended. Here's what's recommended by Emory University. In the setting of a neurologic exam that suggests profound brain dysfunction, a consultation to the neurocritical care or neurology service is strongly advised. Okay, so it's saying they need a team of neurologists, of doctors and surgeons to come together to figure out what is going on. Okay, they clearly advise it to have a staff to consult about it. And then the second one, positive COVID-19 tests must be obtained before any other recommendations. 3, if the patient is COVID-19 negative, the usual brain death determination policy must be utilized. Okay, so if they're negative, then you can determine it's brain dead. The consult team will help establish brain function. If they're positive, identification of persistent confounders and recommended further studies if possible and appropriate. So what is that saying? If they're positive for COVID-19, keep them on life support. If they're negative for COVID-19, declare them brain dead. And it is really sad. It is really sad. It's really sad. This disease, this virus is killing people. It's killing people. It's killing other options and other opportunities that doctors and clinicians have access to get resources and available to help out an unknown illness. Like you, walking death. I look like Oprah right now. Like you're the walking dead. Literally, you're walking dead. You're walking, and then next you're dead. Pictures of people in China passing out dead on the street. Dead. Dead. They're coughing blood. Next thing you know, they're flat dead on the street. Coughing up blood. Blood and mucus. They're just literally coughing it up. Pronounced dead on the street. Oh, I got a lot of stuff. A lot of shit. Man. It is really sad. It is extremely sad. But like right here was the definition of, like we said, it has a lot to do with money. At the same time, it has to do with a lot of other resources too as well. And like I was talking about before, about 20 minutes ago, before I got into this. Thank you, Mr. Brooklyn. Appreciate it. Thank you. Thank you. Appreciate it. Okay. Like I was talking about before, when you have the whole basis of the economy is reliant on prostitution and exchanges for services, then that's another issue as well. And usually, if somebody is a prostitute, they are therefore, according to you, when you break down the word statute, that means somebody is in an stated, okay, somebody is standing or somebody is posted in one area and a fixed amount of time. Say they are posted in one area for a fixed amount of time, and they cannot move from that area unless they provide services to somebody. What is that also an issue of? What is that also an issue of? If somebody is forced to be in an environment, to be in an area for an extended amount of time, what is that also another issue of? Come on. If you're forced to be in a posted area for a fixed amount of time, what is also that another issue of? Slavery. Modern day slavery. They're calling it prostitution. And it's really, there's a difference. There's a difference between a prostitute and there's a difference between modern day slavery. Okay. Now, when you're a prostitute, most of the time you have a pimp or you have somebody providing for you. That's how it works. It's old school mentality prostitution. Don't mess up the product. Don't hurt the product. If at last resort, yeah, if necessary, but don't hurt the product. Okay. Prostitute. You provide resources. You provide. They're taken care of. Okay, their pimp takes care of them. Okay, a regular prostitute, a regular. Thank you. Yeah, yeah. Exactly what happened in New Orleans. What happened in street and yeah, exactly. Yeah. Usually, most of the time, if somebody is a prostitute, they have a pimp, or usually with that time, most of the time, that pimp is called their husband. Okay, they have their husband to pick them up from jail. They have their husband to pay their bills. They have their husband to provide housing services or tell them when to eat. They have their husband to take care of them. They have somebody to take care of them. It could be their husband or it could be their daddy. But most of the time, or their boyfriend. Most of the time, if somebody is a prostitute or they have a madam, but they have somebody in charge of their environment. They have them in a controlled environment. Okay, the environment is controlled. A prostitute, but still at the same time, though, prostitute has the freedom of movement. They still have freedom of the movement, whether they're in a fixed place down the corner or whether they're a fixed place in a hotel. They still are available to go out and they still are available to move freely. A prostitute has no problem with moving freely. That's no problem with moving freely. But when it comes into modern day slavery, is when you prevent somebody from moving. You have somebody in a fixed environment for a few fixed amount of time. You have somebody literally standing still. They cannot move. You do not provide food for them. You do not provide clothing for them. You do not provide housing for them. They are on their own. That's when it becomes slavery, trafficking. Modern day slave. There's a difference. There's a difference. There's a difference between prostitution and trafficking and slavery. There's still a difference between all, but usually when you go to the prostitution to the extreme, then it can go into trafficking and slavery, where you control that person's every single movement. You do not provide any kind of resource for them. Usually a pimp always most of the time provides for his hoe. He provides clothing. He provides jewelry. He provides dresses. He provides makeup. I I do it all the time. He provides for her. Okay, he provides for her or him. He provides for her, and then she goes out and get his money, gets it back to him on with some kind of return. Now, if the pimp is not providing for her, if the services are not, thank you. It's a management. At the same time, though, prostitution is always an exchange. That's the real definition of prostitution. It is an exchange. It has to be an even exchange. An even exchange. If it's not an even exchange, then it becomes slavery. And how you know if it's an even exchange? In the old days, though, in the old days, you had the man and he would send his woman out on dates. Okay, and he would usually be there at the same day or in the same restaurant or in the same vicinity as she was. They would both go into the date together and he would stand to the side and she would get the date. Okay, that was in the old days. Or he would go to the pool hall. They would go to the pool hall together, or they would go to the bar together. And he would stand to the side while she went and go talk to the gentleman. Or he would go in the old Russian days, old school Russian days. The prostitute would wait until company came in and the madam or whoever will let her know, oh, you have a customer, get ready. Or go down. I want you to talk to a customer at the bar. That's how it worked in the old days. They will give notice of when to get ready. But nowadays, it's way out of control. There's no even exchange of anything. There's no even nothing. Pretty much it's who you want to be. It's not even top girl, bottom girl. It's all uneven. It's all uneven. It's all uneven. And this is totally out of control. Where you're putting girls in cages, you're handcuffing girls, you're beating on girls in public. In public, it's horrible. It's way, way, way out of control. Way out of control. Way out of control. And at the same time, is you are providing no kind of resource or no kind of service at all for your business. If that's your business, you're supposed to take care of your business. You see how that works? If that is your business, you're supposed to take care of your business. You're supposed to provide for your business if that's what you're doing. Okay. But right now, like I said before, it is way extremely uneven, extremely, I mean, seriously to the top T. Right now, what's going on the streets? You have these young kids who are barely surviving themselves right now, and now they're trying to manage other people at the same time. So how are you barely surviving on your own? You're living in a roommate in a house with five other guys, and now you are trying to manage five other girls at the same time, and you barely surviving on your own. You see what I'm saying? Like that doesn't make sense. You're barely surviving on your own, and now you're trying to manage 10 other people and get money out of these other 10 people that you're trying to manage. Mm-mm. That's not how. First of all, in the old school days, especially in the 50s and the 60s, the pimps had their own personal business under control, under wraps. Whether it was the drug deal or whether it was the business game or whether it was any kind of game, they had their own game separately apart from the women. So they had their own business, their own game apart from the prostitution game. The prostitution game was completely different from the man's own game. But now people got it out of control. It's out of what? They're mixing it. They're mixing too much together. You can't mix it like that. It doesn't work like that. It's all its own separate entity. Do you know what I'm saying? It doesn't work like that anymore. It's completely out of control. Now they're glamorizing it on TV and the music videos, glamorizing it, glamorizing prostitution, glamorizing stripping. No, you're not meant to glamorize it. It's supposed to be a separate business. So, like, especially in South Dallas, I'm gonna get to COVID in a minute. Especially in South Dallas, you had Flavor TV on Saturday nights. Lady Jane and Skip Cheatham. You had the adult music videos come in on the late nights when adults were available to go out and have fun. Because there's a time and a place for everything. Okay. So you had the adult, even on MTV, even on BET, you had the late night adult music videos, but they were set for a particular time. But now all of a sudden, all in the mainstream media and so you have all these adult music videos, everybody glamorizing it on every single second of every single day. Even a 5-year-old kid can see an adult music video at 10 o'clock in the morning on a Sunday when it was never meant to be like that. And you're glamorizing the high life and living in Miami with 10 women on your shoulder and you're drinking Bacardi or whatever it is. No, and you're doing this stuff every single day. It doesn't, you can't have the high life every single day. Even Beyonce, even Jay-Z, even Kim Kardashian, they don't live like that every single day. No, they don't. They have the low time and they have the high time. Do you see what I'm saying? They have the low time and the high time. There's a time and a place for everything. Beyonce, she has her music life and then she has her family life, her own identity. Lady Gaga has her personal life and then she has her music life. There's a time and a place for everything. You can't just live life like that on 24/7. And then she has a particular, especially Lady Gaga, she has particular times during certain times of the week where she has a press take particular photos of her, but she does not do that every single day. She does not do that every single day of every single month of the year. You can't live like that. She lets the media know, okay, can you let she tells her assistant, can you let the media know I'm about to go to brunch? They can take pictures now. Today's not, or she can let her assistant know today's not a day. I don't want pictures. Do you see what I'm saying? It doesn't work like that. Everything, there's a time, there's a place for everything. And right now, especially with these young kids thinking that they're pimps, thinking that they're controlling things, okay, now it's way out of order. It's out of order. And now, right now in the streets, right now in America, you have young girls out on the street corners at 6 o'clock in the morning. They go back in. Now they're out on the street again at 11 o'clock in the morning. They go back in. Now they're on the streets back in again at 2 o'clock in the afternoon. They go back in. Now they're on the streets again at 5 o'clock. They go back in. You see how that works? It's completely whack. The game is whack. You can't get no business like that all day. And then that person can't even live a life, and you can't give them no money because it's too much exposure. It's too much exposure. If you put somebody on the street at 10 o'clock in the morning on a Sunday, and then you put them back again on the street at 2 o'clock in the afternoon, right in front of the mall or right in front of the business park, it's too much. It's too much on the girl, and it's too much. It's hurting your business. It's not only hurting her, it is hurting yourself and your reputation too at the same time. It's hurting the girl, and it's damaging the pimp's reputation, and it's bringing down his price. You're bringing down your price. It's too much exposure. And so that price used to be $1,000, but 30 minutes later, now that price is $50. It's too much exposure. The game is whack. And that's what I said. When the government's right now, there's so many people in the game, it is ridiculous. There's crack cocaine on the streets. I don't even have the statistics. I'll get the statistics for the drug game in a minute. There's crack cocaine epidemics going back up, as well as prostitutions on the street. Now talking about child prostitution, child trafficking, child smuggling. Oh my God, it's ridiculous. It's out of control. It's out of whack. The timing is out of whack. Yeah, I know the pimp does oversee some things, but understand, if you are a manager, you know how to manage time as well as people. Managers are especially good with time. If you are a manager and you don't know how to manage time, you are not a manager. You are just a sleazeball. The best managers know how to put the people out and bring them back in and make the most money. If you're on the sales floor, you know how to hire the best workers at the highest amount of time where you can get the most business contact. Where you have the best workers with the best customer service, the best attitude, and you get them in a store at that particular time. You let them know, hey, yes, what shift do you want to work today? Oh, I don't know. Can I get the Saturday shift at 2 o'clock? Okay, you get the Saturday shift, and you can have that worker bringing more money at that particular time to the store than all of your whole employee roster combined. That one person can bring in more money to the whole store in just 4 hours than your whole employee roster. It is ridiculous. But at the same time, though, you can have people like LeBron James, where he's going from team to team to team, and he's overworking himself. He's the best in the league. He's the best in his team, but he's getting too much exposure, and he's overworking himself. He's too hard. He's too hard. The league management is overworking this man. He's having to manage every single body and having to tell everybody to do every single thing. It is ridiculous. LeBron James is the best in the league. He's MVP over every single team in every single league of the NBA right now. He is MVP. But LeBron James is also having to manage every single player in the NBA, as well as manage the Black Lives Matter movement, as well as manage his own organization, his own nonprofit, as well as manage his own family life. So look, you can't have LeBron James for everything. LeBron James can't be LeBron James for everybody. Do you see what I'm saying? He can't be everything for everybody. Do you know what I'm saying? He's making a lot of money. Yeah, he's making a lot of money. But at the same time, how old is LeBron James? How old is he? Like 33, 33, 32? And he's aging so fast. He's aging ridiculously. His hairline is growing out of whack. He's aging him because he's having so much stress on his young, what is he, 32? And his headline is receded so much. It is ridiculous. You're putting stress on that person's body, and you're damaging the product. Yeah, he has a high price. Yeah, LeBron James is good. Yeah, he makes good money, but you're damaging him. That's why when you had Michael Jordan, everything in time and season. Michael Jordan had his own time. He knew when his time was done. Then he went to baseball. Then he came back. Like what Russell Wilson's doing right now. He went from football, now he's in baseball. And baseball, he's gonna go back to football. You know what I'm saying? You have to balance it out some way. And right now, that's what's going on with COVID. It's unbalanced. The season of time is unbalanced. What's going on in the world is unbalanced. The normal equilibrium of people's bodies is normal. It's normal to have a seasonal flu. Life, the whole medical dictionary, the Armour's Almanac from the 1200s. Say, expect the seasonal flu. You have old farmers' almanacs from the 1200s, from Little House on the Prairie days. Expect the seasonal flu in this time of the year. Expect the seasonal flu in this time of the year. It's normal. The flu is normal. What's not normal is people's symptoms adjusting to it and the symptoms getting out of control. And you have somebody 10 minutes later, they're comatose on the street, dead, brain dead. What happened? They got COVID-19, covered them up, and called the Department of Health and the police. So again, there's a lot of issues that need to be addressed. I mean, you can have somebody like LeBron James try to manage the whole COVID-19 issue. That's great, but the man's getting tired. He's getting worn out. Yeah, these men they need to be healthy. Of course, we get close the league down to make sure that our players are healthy. But at the same time, though, okay, you can't have one man do everything for everybody. You have to have some of these men speak up about the issue. Colin Kirkpatrick, he could have kneeled down for himself. He kneeled down for everybody. And then everybody else came into the league and joined with him. And now all of a sudden, 10 years later, after he got fired from the NFL, now all of a sudden, 10 years later, he's getting the recognition that he deserves. But Colin Kaepernick couldn't be everything for everybody. And so that cost him his career out of that when he tried to be. You see what I'm saying? He tried to be everything for everybody, but he couldn't. See what I'm saying? It cost him his career. I'm trying to be a great football player. I'm trying to protest for Black Lives Matter. I'm trying to be a family man. I'm trying to be a great, great, great family man to my girlfriend. You know what I'm saying? I'm trying to be all these things. But you're the top of your league. You're one of the best football players for the San Francisco 49ers. You need to focus on what you need to focus on. Your focus right now should be on your career. Black Lives Matter will come to the side. That's great what you're doing, but you need to let somebody else handle that. Do you see what I'm saying? And his career suffered as a result of that. He got worse and worse every single game. Throw it off. Throw it off. His game got horrible. He kept fumbling on the ball, missing catches. His career got worse and worse and worse. It got stanky. But Colin Kaepernick is still great. I love my K-Pat. But you can't let a disease overtake your life, overtake your career. What's your focus? And again, it has to be the normal rhythm of life, the normal flow, the normal time circle flow. Okay, management, but management has to do a lot about time. Timing is everything. Timing is everything in management. If you have a manager that is not good with timing, you need to go somewhere else. Do something else, go somewhere else. Don't waste your time. And they don't recognize you on top of that? Yeah, and FEMA did have concentration camps, especially in the Superdome in New Orleans. I still have not been to the Superdome. I've seen the outside of it, but I have not been to the Superdome in New Orleans. I've been in New Orleans 3 times. I've been to Baton Rouge about once, twice, maybe 4 times. Passed through the casino. You know what I'm saying? So there's a lot of other issues that need to be addressed. Okay? Like the management is way out of control because doctors and on top of that, like I was saying before, with the second wave, thank you, Mr. Brooklyn. With this second wave, that means because of this second wave, the strain is going to be even stronger down south, which happens to the flu virus every single year. Okay, so you have the vaccine manufacturers have the vaccine development in New York and DC. That's great, but that only applies to these populations in this region, in this vicinity. So now Pfizer research or whoever is developing the vaccine has to go down south, test all these people, test their antibodies, do some research clinical trials in order to figure out how do we properly get the right vaccine for this type of population. Because if you are going to try to get a generic vaccine for a generic population, please believe, don't even let them touch you. And expecting to get this vaccine out in the next 6 weeks. No, Mr. President, that will not work. And right now you have a second influx of COVID-19, and you're expecting to get a vaccine out in 6 weeks. That is not going to happen, Mr. President. That is not going to happen. Not going to happen. You have to develop, you have to develop, figure out what is going on in people's bodies and why our bodies are not naturally developing immunity against this virus. What is going on in our bodies? What are we not eating? What are we not digesting? What are we not processing for our bodies to naturally get rid of, naturally waste out, fumigate this virus from our bodies naturally? Okay, because usually when you get a virus, it usually comes into you either through any kind of fluids. Okay, your oral cavity, your nasal cavity, and even in your skin contact, and then it flushes through your system naturally. Either it flushes out your nose, it flushes out out of your mouth and your nose, or it flushes through your urinary system naturally. And you notice when you urinate and you've had a cold, when you've urinated and you've had a cold, you notice that there's mucus in your urine because you just had a virus pass through your system. You notice that there is mucus in your urine. It's natural because the virus has to go through your body naturally. It's natural. Or you may have mucus in your stool, which is natural. It's natural. It's natural to have mucus in your stool. Green mucus, different color mucus. It's natural for it to pass through and be in your stool. It's natural. But again, it's a lot of issues of why our bodies are not able to naturally waste out this virus from our bodies in a natural way. So it must be something in our systems, in our body, that is building up resistance, that is not letting us to naturally flow out, or that we are not eating naturally, eating, okay, processing, naturally digesting into our system, whether it's fiber, because the American diet is really low on fiber. The US American diet is extremely horrible with fiber in our systems. It can be something simple as fiber, or something as simple as vitamin C, vitamin D, especially in African community with vitamin D, as well as iron, folate. You know what I'm saying? Normal vitamins. Eat iron. Eat your beans. Eat your kidney beans. Eat lettuce. Eat cabbage. Normal, natural. I'm not talking about lettuce on a hamburger. I'm talking about normal, beautiful salad, kale, uh, spinach. Normal leafy greens that have natural iron and fiber in them. And it's surprised the American diet, not just a black diet, but the American middle class diet is lacking a lot of these good, wholesome nutrients. I mean, you can find them in pasta a lot, but a lot of times white grain pasta does not have good fiber. You have to get that whole wheat pasta or some other flavor of pasta to get with the nutrients that you really need, which is like spinach pasta, tomato pasta, whole wheat pasta, to really get the resources that you need. Because if you're eating spaghetti every single day, that is also another issue. Okay, so there's other issues that need to be addressed, Mr. Brooklyn. Okay, there's other issues that need to be addressed. Yeah, you can be a pimp, you can oversee management, but sometimes a lot of these young cats, these young kids, these young uh 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 young bucks, these young, literally young bucks. Okay, I've been harassed, abused, and assaulted by a lot of them. Most of the time they think they got it under control, but they don't, because they got too much going on in the pot, too much going on in the kettle. So what usually most of the time, if these young cats have girls, have prostitutes, they usually follow them around every single where they go. And on top of that, the girls not only follow their pimps around every single where they go, but they all dress alike, which is a no-no in the pimp book. Is a big no-no, because you want your product to look good. You do not want your product to look the same. You want your product to be different, and you want your product to be unique. You want your product to be classy, and you want your product to be expensive. And when you have your product walking around with you every single day, looking alike, dressing like, and they're walking hand in hand, holding each other's hands, they're wearing the same shoes, the same hairstyles, the same pants, the same colors, the same jewelry, that is another issue. And therefore you are extremely devaluing and lowering your price. Now, if you do that in Vegas, maybe you can get away with it, like the Double Mint twins, but not in normal everyday America, because normal everyday Americans catch on real quick. Real quick. If you see a grown man with 3 young girls and they are all dressed alike, that is an issue. And they're wearing flip-flops and they're all dressed alike, that is a major issue. You need to call the police. That is a new pimp style. It is so it's cheap, and it means that he not only controls their clothing, he not only controls what they wear, he not only controls their hair, their makeup, all that, but he controls their mind. Which means he looks at all the women and he says, you women are all the same. And because you all are the same, you will be the same and you will do the same thing until I tell you it's different. If you try to be different, you will get punished. If you try to be anything different than what I want. Don't be anything different than what I want. Be what I want you to be. Because I'm the man and I got control. Don't step out of line. Don't step out of line. And that doesn't necessarily mean walk in a straight line. It just means don't step out of line. Don't do what I told you not to do. Okay? It's simple. It is very, very, very much simple. Just like that. And the new game is so messed up. So messed up. It is extremely, extremely messed up. Real bad. Real bad. Real bad. These girls don't even know they're being controlled. They think they look cute because a man fixes them up, but that's not how it works. Even in Julia Roberts' Pretty Woman, she still had control. Tina Turner, she still had control. She ran for her life, but she still had control. She still had control. Okay? She still had control. When you have people dressing like that Jackson 5, 50s, 60s stuff, where pretty much people are going around like you're some sort of entertainment. This is not entertainment. This is not anything funny about this. You're slaving these girls. It's not a gig. You're making slaves out of them. And it's not the 60s and the 70s. And they are not friends. They look alike, they dress like, and they have a man on their shoulder, they hand in hand. These people are not friends. Don't try to be nice to them because they are all about business. Oh, yes, they are. Even the girls. They are all about business. They are very business-minded too. And they are very much brainwashed into accepting that as their reality, that we have to do this to survive. They are literally brainwashed, the same tape over and over again. And you try to talk to them, and they don't look at you like, what are you talking to me for? I don't need your help. So it's a lot of other issues, a lot of management issues too as well, Mr. Brooklyn. It's a lot of other issues that need to be addressed. You are absolutely right. Now, it's 3 hours going into this conversation. Yeah, FEMA's another issue too. And I haven't heard a lot from FEMA since this coronavirus. I've heard that SBA's opened up business loans, but I have not heard from FEMA. Exactly, the storm does need to kick in. Yeah, kick in the storm to kick in, or the medicine to kick in. Which one? Yeah. Oh, you mean there's a storm? Yeah, there probably will be a storm, but I'm still going to show up. Okay, so there's a lot of other issues that are involved in COVID. Okay, You still need to address the issue. And that's the problem, because the doctors, I need to get an ICD-9 book today. The doctors are not able to properly diagnose this disease. They can't deal with it. They can't figure it out, because the symptoms change every single day, and you have to be very careful, because someone may say they're asymptomatic, they don't have any illnesses, but they may be from New York City, and they may have already overcome the virus, and so because they overcame the virus, therefore they are asymptomatic. You see what I'm saying? You see what I'm saying? And they don't have COVID-19, but they are asymptomatic because they they tested positive once, but now they don't have the virus anymore. So we have to figure out the true definition of what really is asymptomatic. Does it mean that somebody is positive and they don't show any more symptoms, or does it mean that a person that is not that is negative doesn't show you know what I'm saying? Like, what does it really mean? What does asymptomatic mean? Like, asymptomatic could be like a person has been tested positive for HIV and they don't have any more symptoms, their viral load is high. Do you know what I'm saying? So that person can be asymptomatic to HIV because their viral load is high, therefore they're not diagnosed as having HIV. Do you know what I'm saying? But they still have HIV. See what I'm saying? It's out of control. It's out of whack. It's out of character. So the CDC, the WHO really need to clearly, in bold terms define what is what symptoms are what applies to what. Get what I'm saying, Mr. Brooklyn? All right. Okay. Thank you so much, guys, for this 3-hour live video. I really appreciate it. I've got a lot of coffee in me. My office is still a mess. I'm pretty much getting ready to get packed. I've got some dresses ready, as well as I got some business suits, professional business suits, and I need to get some pants. Okay. All right. So, guys, please keep me in your thoughts and prayers. Thank you, Mr. Brooklyn, for hanging with me today. I really appreciate it. Okay. If you're a young person, okay. So there's a lot of other issues that need to be addressed too. Okay. Mm-hmm. Mm-hmm. Brooklyn. Quickly. Frankly. Okay, so there's other issues that need to be addressed. Okay, you have to do things one step at a time. Okay, seriously, it's literally going to take one step at a time. Okay, thank you, Mr. Brooklyn. Thank you. All right, guys. So thank you so much. I really appreciate your time. Thank you. This is LaQueen Battle from Battle First Aid Responder Services. My office is a mess. Please. Oh, yes. I'm available for appointments. I do peer counseling. I do peer therapy, as well as I'm getting applied for that with the state of Massachusetts for peer support. I'm going to be getting my certification real soon for that, as well as I'm getting my certification in HIV. I'm going to go to New York in a couple of days to take some classes for that, as well, doing it online. I'm certified too, and a lot of other stuff. I gotta go out, just get some eat, do some shopping or whatever. I just need to get out, as well as get a room for tonight. I am a hot mess. Oh my God, look at me. I just need to go and just like chill for somewhere and just go to sleep. Just like take a shower and just like chill. All right, babes. Okay, so this is LaQueen from Battle First Aid Responder Services, I'm a certified national medical assistant, certified adult and pediatric first aid. I do naloxone, opioid, Narcan recovery assistance, as well as CPR. And I need to get, oh my God, I need to get a fire extinguisher. There's a lot of other stuff that I need to address too as well, okay? I'm still working on it. I'm a hot mess, but I'm going to try to get it together. I'm going to try to get it together. Okay. So this is LaQueen from Battle First Aid Responder Services. I love you guys. Please keep me in your thoughts and prayers, okay? As well as I'm available here. My office is here in downtown Boston. I'm available for appointments for peer support, peer therapy, okay? As well as, just basic daily counseling, okay? Peer counseling, whatever you want to talk about, okay? As well as I'm going to be providing first aid classes as well as CPR classes in the next 2 months, guys, okay? I love you guys. Please continue to keep me your thoughts and prayers. And I'm on Venmo, Cash App, and PayPal. All right. Thank you so much, guys. Love you. Bye.